Morning.
Good morning.
Morning.
This meeting is now called to order. I'd like to make a preliminary statement, and then I will call Senator Go at his request for a brief presentation, and then I'll call everybody, and everybody will have at least 10 minutes to ask questions right away. Good morning to our colleagues, and let me call on the Director General, Rudy Kimbo, to acknowledge and swear in our guests. We have already recognized the senators. If I have not, please acknowledge the senators right now. Go ahead, Mr. Kimbo.
Your Honors, the senators present are Senators Joel Villanueva, Juan Miguel Zubiri, Jaime Marcos, Pia Cayetano, Francis Pangilinan, Christopher Go, Risa Ontiveros, Senate President Vicente Soto, Senator Ping Lacson, and Senator Franklin Drilon, Your Honor.
Thank you. I acknowledge the presence of all the senators aforementioned and welcome them with appreciation for their attendance and their malasakit. Go ahead and please,
Senator
Chairman,
Angara, I'm also here.
any new guests to
Chairman.
swear?
Mr. Chairman, good morning.
Yes, Your Honor, there are. The newcomers are Dr. Leopoldo Vega.
Can you please raise your hand? Okay, Mr. Vega, go
Your
ahead.
Honor, may I suggest that instead of raising their hands, which will make it difficult for us to look for them, can they just shout present or here?
Your wish is my command. Please acknowledge the direction of the Director General and say present if you're here.
Present, Your Honor.
And say your name. State your name, please.
Present, Your Honor, Dr. Leopoldo Vega of the Department of Health, sir.
Thank you.
Your Honor,
Chairman Dick, this is Senator Angara. I'm also here. I was not acknowledged. Thank you.
I can see you. It's hard not to see you.
my apologies,
Thank you,
Senator
Chairman.
Angara.
It's all right. No problem.
Senator Angara is welcomed and is part of this meeting right now. Go ahead.
The new attendees, Your Honor, and they are also for taking their oaths are Dr. Maria Rosario Vergere, OIC Undersecretary for Public Health Services, Dr. Angeline Del Mundo, Director Ronald Lo, Dr. Lunita Corpolon, all of the Department of Health. From the IATF EID, the following are here. Vince Dizon, Undersecretary Brigino Tulay, Yusek Manica Intik, Assistant Secretary Edita Tan, Assistant Secretary Sharif Grande, OIC ASEC Eva May de la Rosa, Director Janaira May Halasco, and
Excuse me,
Dr. Nina.
may I call on the technical committee? Can you call on WebEx to please fix the communication system?
Your Honor, may I proceed?
Okay, go ahead.
From the National Task Force Against COVID-19, Secretary Carlito Galvez.
Yes, sir.
Yusek Mark Dennis Hoven, Director Carissa Cruz,
Excuse me, I cannot hear them say present. Are they there?
Present, sir.
State your name and say present because it's hard enough as it is. Can we ask Eduardo Rivera to mute? Mute yourself, please. Go ahead, Dr. General.
from the Department of Budget and Management, Mr. Dixon Panti, Chairperson Bids and Awards Committee 1 Procurement Service, Phil
Present,
James.
Your Honor.
From the Food and Drug Administration, Dr. Rolando Enrique Domingo, Director General.
Present, Your Honor.
Thank you.
From the Philippine Health Insurance Corporation, Attorney Jose Marie Tolentino, Senior Vice President.
Present, Your Honor, Mr. Chair.
Attorney Rogelio Pocalan Jr., Senior Manager.
Present po.
From the Private Hospitals Association of the Philippines, Dr. Jose Rene De Grano, President.
Is he present?
He has not answered yet. Is Mr. Dr. De Grano, are you around?
Can you mark
Still
him
marked
absent?
as present. He probably logged in a while ago. From the Philippine Hospital Association, Dr. Jaime Almora, MD.
Dr. Jaime Almora, present, sir.
Thank you.
From St. Luke's Medical Center Employees Association, Mr. Sherwin Boscosa. Are you here?
St. Luke's, are you there? St. Luke's, we're looking for you.
They are marked present, Your Honor, because they appeared a while ago.
Present, Your
From
Honor.
Ambitech,
What is your name? Will the representative from St. Luke please sound off? St. Luke's, are you there? You could be on mute. Okay, please proceed. We'll take care of that later.
He's on
Go
mute indeed. But, Mr. Chair, from Ambitech Biopharmaceuticals Inc., Mr. Dipo Patya.
Your Honor, present, sir.
From IP Biotech Inc., Mr. Enrique Gonzalez.
Present, Your Honor.
Dr. Noel Miranda, Sinovac local sponsor, IP Biotech scientific team member. Dr. Miranda.
Dr. Miranda, are you there? Please proceed, Director General, and mark Dr. Miranda as not sounding to the call, not answering to the call, not responsive.
Yes, Your Honor. Attorney Adel Abbas, City Administrator, Office of the City Mayor of Calapan City, Oriental Mindoro.
Present, Your Honor. Present, Your Honor.
Attorney Joselito Castro, Chief Legal Officer, City Government of Tarlac.
Attorney Joselito Castro from the City Legal Office, present, sir.
Thank you.
Dr. Tony Liachon,
Good morning, Mr. Chair. Good morning, sir.
Good morning.
Attorney Lloyd Christopher Lau, former Undersecretary and Head of PSDBM. He's appearing under subpoena.
Mr. Lau, are you there? Attorney Lau?
He might be on mute, Your Honor. He was here a while ago. Actually, he's opening his mouth, but I think he's on mute, Your Honor.
Well, we need you to unmute. Please answer if you're there. All right, mark him as unresponsive or absent for the moment. Go ahead.
And Miss Heidi Jordan from Sakay Cooperative.
All right.
May I request, Your Honor, that their oaths be administered?
Will all those people that
Your Honor, I am present, Lloyd Christopher Lau, Your Honor.
all right,
Mr. Christopher
Lau
Lau,
is
congratulations,
marked
Your
as
Honor.
present now. Can we ask those who have not, whose oath has not been administered? Otherwise, I'll have to ask you. Please raise your right hand, all of you. Those who are new.
Your Honor, I was not acknowledged.
Is that Dr. Virgeri?
I'm Maristela Abenojar, Filipino Nurses United, Your
But
Honor.
Miss Maristela, Your Honor, Miss Abenojar was already here the first hearing. We called those who are here for the first time. Your
We
Honor.
have to take note if they're here again, Director General, and we have to take note of the new ones. So please,
Yes, Your Honor.
be
We
careful to see to it that those who are new before they're called have been administered their oath. Go ahead, please.
Yes, Your Honor. Raise your right hand, please. Those who are here for the first time and whose names I called a while ago. Can you raise your right hand, please? Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth in this proceeding? Your
Yes,
Honor,
Your Honor.
unless someone objects, may
I
I
object.
be allowed?
The chairman objects. Please take a picture of those raising their hands so that we can state for the record. Can somebody take the screenshot? Director General?
Done? We're
Tell me
taking
when
their
you're
shots
ready.
now, Your Honor.
Sorry?
Done, Your Honor.
Are those the only ones? You took only one screen?
4 screens, Your Honor. 4
Four
screens.
screens. That the record state that you took 4 screenshots so that we can refer to it later on should there be any questions. So
Yes,
do I
Your
then
Honor.
administer the oath now? Have you done it?
Your Honor, we already administered your oath.
Well, in spite of your baritone voice, I'm sorry, I'm hard of hearing today. Okay, let the record state that the oaths have been administered to the persons concerned. Let me make a very short preliminary statement. Again, I thank all the senators present and all the guests are been acknowledged, and we appreciate your presence. This is, again, a continuation of the investigation that we called motu proprio. That means on the Blue Ribbon's own initiative, we conducted this investigation. And since that time, the senators have already also filed new resolutions, which the Director General will state a little later after I make my preliminary statement so that that can be properly recorded. Now, let me just proceed. Last time we had a hearing, and of course, you're all aware of the fact how important these hearings are now, especially since we are in a very, very severe situation where more than 30,000 people have died. And the other day, I think we broke the record in terms of positivities that have been incurred. 18,000. I have not seen the record today, yesterday, and today. Let me just point out that there is a very, very deep sense of urgency on the part of the chair and all the members of the committee. Bigyan ng papahalaga at klaruhin ang mga narinig natin sa television at nababasa natin sa mga pahayagan at sa mga salitaan. At kailangan dito malinawan yung mga duda na lumalabas at the chair promises to be firm and fair. You'll get your say. And if you want to speak up later on, you can raise your hand and we will recognize you. In the meantime, the proceedings will be undertaken, as I said, 10 minutes per senator. And we shall be very quick and we can do a ronda after that. This committee proceeds under the old Latin maxim propounded by Cicero 2,000 years ago, Salus Populi est suprema lex. The welfare of the people is the supreme law, particularly on the matter of health. And that is why it is important that we proceed post-haste. Lugbog na ang bayan natin, 30,000 na namamatay, and we have so many people unemployed, about 4 million of them, more or less. And at nakikita natin, marami rin nagugutuman, at marami rin tumutulong, marami rin ang nahihirapan, at araw-araw, marami nagkakasakit. Even in my staff, yesterday there was one lady after the swab that got a positive result, and she's now under quarantine. So our resources are certainly stretched, and our hospitals are certainly stretched, and our quarantine centers are certainly stretched. Ibig sabihin, punong-puno na ng mga tao. At although dapat talaga pag malasakitan, hindi natin maalis na sasuffer tayo ng anxiety. At nagkakaroon yung iba sa tagal ng ating mga lockdowns ng almost anxiety attacks or mental health problems could emanate from this. And I hope that doesn't occur dahil sa ating nanaranasan. Kakarampot lang po ang pera ng ating bayan. Hindi tayo mayaman. Pero yung 11 trilyon na utang and counting ay talagang eventually babayaran ng lahat ng mamamayan yan. At hanggat sa kanilang kaapu-apuhan. Sa ganitong sitwasyon, tungkulin ng pamahalaan na ibsan ang kahirapan at dapat makakaharap tayo sa ating mga mamamayan na yung i-set aside na pera ng gobyerno, ng inyong kongreso, ay talagang magagamit sa wastong pamamaraan at hindi nilulustay o dinanakaw at walang fraud, waste, and abuse. Kung may mga katotohanan ng mga narinig natin at nababasa natin, madaming kahindik-hindik ang nangyayari sa pera ng sambayanan. At ang mga gumagawa nito ay kahintulad ng mga sawa na nakapasok at pinapasok sa manukan at nililinggis at kinakain lahat ang mga manok at sisiw sa loob ng manukan. O dili kaya sa anay na patago ang pagkain ng bahay na sa kalaunan ay basta babaksak na lang. O dili kaya sa mga buitre na naghihintay humina o lumupasay ang kanyang target at kakainin na lang nito ang kanyang biktima kahit napatay na ito. Our nation is in deep crisis. Our healthcare system is gasping for air. It's hemorrhaging and in extremis. And our healthcare workers, including those in the government, and I'm not saying that those in the government are not doing their job. Everybody, I'm sure, in the government, and no exception, from the cabinet secretaries to the undersecretaries to the directors and everybody, we presume are doing their utmost in this effort. Ang mamalasakit lahat yan. At kung may pagkukulang, maaring meron talagang nakakalusot at talagang sinawag na nga nating sawa o kaya mga taong na hindi maayos ang pamamalakad due to lack of foresight, lack of skill, or negligence. Yan ang pakay nitong committee na ito sapagkat ang committee na ito ay maghuhusga kung kayo ay may malfeasance, mali ang at talagang masama ang pagpatupad nyo, misfeasance, hindi kayo masyadong magaling magpatupad, o di kaya man non-feasance, hindi nyo ginagawa ang iyong tungkulin. In our hearing last week, August 18, 2021, we made not insignificant gains in favor of our health workers. In this hearing, we want to follow up as to what became of those gains, so-called. Pinatupad na ba? May nangyari na ba? Sustainable na ba? Ulitin ko yung sinabi natin, kung mahihirapan ang ating mga healthcare workers, ang ating mga doktor, mga nurses, at hindi lang yung mga titulado, mulit kasama na ang mga janitors, kasama na yung mga nagtutulak ng ating mga gurney o yung mga nagtutulak ng wheelchair, at yung mga nagtatrabaho sa ospital at maganda at sinabi na mismo ng COA na nagbago ang sitwasyon na itong variant na Delta ay nasa air, nasa impapawid at pwedeng makuha kahit na ikaw ay hindi ka nagtatrabaho sa COVID ward at dapat isama yung mga wala sa COVID ward na nagtatrabaho sa ospital. In other words, all hospitals are considered dangerous places, hazardous places of work. Kaya kailangan masingil natin ang tungkulin ng gobyerno na maibigay sapagkat kung wala sila, kailangan ibigay sapagkat kung wala sila, babaksak ang sistema ng ating kalusugan. Agreement between ang mga gains natin supposedly, and I'd like to be this to be confirmed as we go along, between COA and DOH towards a more liberal interpretation of the words, quotes, directly catering to or in contact with COVID-19 patients, as to be the basis for the grant of special risk allowance under Section 4H of RA 11494 for all workers in the hospitals that may have been exposed to the airborne virus. This will include, as I said, our janitors, orderlies, and other similarly exposed personnel in our hospital, whether they're in the ward, COVID ward, or non-COVID ward. 2, to have an arrangement that will receive the complaints of the health workers. Sinabi ni Secretary Duque, maglalagay siya talaga ng isang tanggapan na talagang araw-araw may access ang mga taong nahihirapan sa lalo na sa mga healthcare workers natin para madaling maibsan. Ako mismo sa Red Cross at lahat ng pinasukan ko, karaka-raka uma-action tayo. Hindi tayo naghihintay sapagkat lalo na kung ang mga pangailangan ay talagang importante, hindi tayo nagpapagabi, hindi natin binubukas, walang manyana, kailangan masundan kaagad sapagkat pag namagayan, katulad na nangyayari, maraming mahihirapan at maraming mamamatay o lalong gagastos sa health. Yan ang pangako ni Secretary Duque to the payment of SRA as soon as possible. Isa pa yan. He promised to look for money from savings. At yan gusto natin malaman kung nakakita na siya ng savings na tinatawag niya. Meron kami nakikita pero dapat sa inyo manggaling yan, Secretary Duque. According to the press statements of Secretary Duque, special risk allowances for healthcare workers are ready for distribution beginning today. That's good news. I even hear that even the ambulance drivers and all those being exposed are now being called to task. I see good and I will acknowledge it, and when I see evil, we will certainly destroy it. DBN promised that they would meet with DOH on August 23 for the release of a circular implementing the salary of SG-15 ng mga nurses for entry-level nurses and correcting the wage distortion brought by DBM Circular number 2020-4. I will ask DBM to answer and report along with DOH sapagkat sinabi nyo na naayos na yan sa Executive Secretary's Office o Office of the President. Kaya dapat mabigyan na natin ng talagang definite answer na naayos na yan. Sabi nyo naayos na at itong August 23 matatapos natin yan. Hindi lang problema ng mga nurses ang ating tinititigan, pati na rin ang problema ng mga ospital. Maraming ospital ay dapat bayaran. At ang patakaran dyan, kaya tayo may PhilHealth para bayaran ang mga ospital. Pero pagka fraudulent ang singil, huwag naman nating lahatin, huwag natin tanggapin yung fraudulent at bayaran natin ang ospital sa kanilang sinabmit na hindi fraudulent. Mali naman, nasalahatin natin ang ospital sapagkat hindi dahil sila ay mga santo, pagkat hindi naman lahat ay santo, kung sa totoo lang, pagka sila ay may mali, dapat singilin kagad at sabihin hindi ka bayaran at para sa ganon, they will pay attention diligently to the task of collecting alleged claims. In a pandemic, we want to make sure that medical services, kailangan lahat ng ating ospital ay umaandar at available to our citizens. At ganoon na rin ang mga citizens natin. Pag pumasok, meron tayong kinatawag na case rate at mga pag sa government, no balance billing. Di mangyayari ito kung magsasara ang ating mga ospital, lalo na yung mga pribado sapagkat mapipilayan tayo. Alam ni Secretary Duque yan, alam ng lahat ng mga mamayan, kaya PhilHealth, dapat kayong magbayad kaagad. Halimbawa, may kaklase ako sa Makati Medical, tinanong ko lamang, ang utang ninyo, ang receivable ng Makati Medical ay hindi katanggap-tanggap. 1.2 billion. Tumatanggap rin na mahihirap yung Makati Medical at mga emergency, kaya dapat mabayaran yan. At ganoon na rin sigurado sa St. Luke's. Sinasabi ko lang yan, hindi para sa pangmayaman. Inuumpisa ko sa pangmayaman, pero maraming maliliit na ospital na pinapaandar na dapat matulungan para hindi magsasara at mabayaran yung kuryente, mabayaran yung kanilang gamot na gastos at yung mga maintenance and operating expenses sila at yung mga ambulances nila kung kailangan bayaran na yung mga na-expose dapat mabayaran at masingil yan. Also in the last hearing, we discussed the issue of overpricing. At yan ay kaya natin inimbita si Secretary Lau sapagkat siya ang nasabi dyan. At mamaya tatawagin natin siya dyan. At ito ay hindi magtatapos sa araw na ito, I'm sure. But we want to clarify all these issues as soon as possible because sabi nila, napakadami na po natin kailangan ayusin. We have to survive this pandemic. No, we have to prevail over this pandemic. Because kailangan maayos natin ang hanap buhay ng mga tao. Marami nagugutom, hindi tayo pwede magbigay ng ayuda forever. Kung gusto natin, kung kaya natin, pwede. Pero kung hindi natin kaya, mahihirapan lalo ang mga tao at baka magkaroon tayo ng mga hindi ka nais-nais na social unrest na tinatawag. So today, we continue with our hearings and I just want to make sure na nare-realize ng lahat kung gaano ka-importante at itong mga gagawin natin. Andiyan ba si Senate President Soto out of respect? Natawagan ko siya for a brief statement. Senate President Soto, are you there? Happy birthday. Go ahead, sir.
Yes, I'm here. If you can hear me.
I can hear you, sir.
All right. Thank you, sir. Thank you, Chairman Senator Richard Gordon. With your imprimatur, allow me to make an opening statement on the issues that are besetting your committee. And I will not be using my 10 minutes later. I'm sure I can leave the questionings to you and our colleagues. But let me just state for the record, again, there is a saying that goes that no man can hope to find out the truth without investigation. Likewise, to investigate the problem is indeed to solve it. So we are here today in your committee, the Committee on Accountability of Public Officers, in hopes to find the truth, to be able to find a solution or an end to this recurring problem on the utilization of the Department of Health budget. Even during the time of ERAP, that I was vice chairman of the Committee on Finance, handling the budget of the Department of Health. Ito recurring problem. At ang nangyayari, sa mga kababayan pa natin, nakikita ko sa social media, parang nagagalit pa sa atin. Bakit daw tayo nag-iimbestiga? Paulit-ulit ang problema nila eh. Di ba? Kaya ganun eh. So for the second day of your investigation, the Blue Ribbon Committee, on the 2020 COA report and other related budget utilization of the Department of Health, especially its expenditures related to the fight against COVID. This representation, together with my other colleagues, have two objectives in attending this hearing, and this is my personal objective. First, we want to seek clarity on the role and mandate of the Procurement Service, Department of Budget and Management, the PSDBM. Related to this, this representation would like to get answers to, first, are the PPEs, testing kits, medical supplies, and other equipment for COVID-19 response really considered as common use supplies and equipment, o yung CSE, that do not necessitate a memorandum of agreement as declared by the Department of Health? Mr. Chairman, I just checked the list of the CSE from the PSDBM website as of yesterday, August 24, 2021. And the mentioned COVID-19 supplies and equipment do not exist. They are not in it. So is there another CSE list? All right. Furthermore, according to the statement of COA on August 22, the PSDBM failed to remit to the National Treasury 10.87 billion in unutilized funds and remained dormant for years. So like in any investigation, why one of the primary questions will always be, ano nangyari? Yarn. Anyari. So why did it happen? So while your proceedings intends to look into the budget utilization of the DOH, the limelight has shifted to the PSDBM during the previous hearing by reason of the 42.4 billion transferred to it by the DOH, which led to numerous unanswered questions. Thus, the Blue Ribbon requested, Senator Gordon requested this representation signature on a subpoena to be issued to Attorney Lloyd Christopher Lau, former head of the PSDBM, and I readily signed the request of Senator Gordon. All right. Secondly, given that we are investigating the COVID-related procurement, why don't we explore the possibility, and may I request the chair also later on, Mr. Chairman, to explore the possibility as well of providing free COVID testings to all Filipinos. While the government is much devoted to COVID-19 vaccines, our COVID-19 testings have been somewhat neglected. Marami po mga kababayan natin, meron kami mga kamag-anak, kaibigan, na isa lang talaga yung nagkaroon ng problema at nagmamanifest ng symptoms. Pero yung ayaw magpa-test, bakit? Mahal daw. Bukas makalaba, buong pamilya na. Positive na sila lahat. At saka pa lang magpapatest. At saka pa lang mangungutang. So I personally know that some have opted not to be tested because they would rather spend their money on food and other necessities than on testing. So evidently, the daily tally of cases does not reflect the actual number of people infected with the COVID-19 virus. So corollary to this, contact tracing as preventive measure to further spread of the virus will come to naught. Now, Mr. Chairman, Congress has been working hard on the country's budget to ensure that the needs of our people be addressed. And it is very disheartening to see that much needed fund is just lying idly and put to waste, especially that we are in the middle of a crisis. Maybe these funds could instead be allocated for free mass testing and help save lives. So finally, may I say that for the record, the effective and efficient spending of the government's budget cannot be overemphasized. Logically, improving government spending will improve lives, and exercising this body's oversight function to ensure accountability of public officials is one of the means which could aid in achieving this objective. So, thank you. Having said all this, I would like to commend the chairman, Senator Richard Gordon, and the committee on accountability of public officers for this undertaking. I will be listening to your resource persons in the meantime. Thank you very much.
Thank the Senate President and wish him again a happy birthday. Even his mustache is now gray hair. But I know that he had a great happy birthday yesterday. He's well loved in the Senate. Let me just point out that the position of the chairman in a quick reaction is that testing must really be free, and that under the universal health care. Meron lang tayong inuna na mga katulad ng mga doktor, yung mga health workers, yung mga senior citizens, yung mga may mga comorbidities, nakalista yan. Pero dapat libre talaga yan. At I want to say na dapat umpisahan na kagad yan. At matagal-tagal ko na kinakausap ng PhilHealth dyan na gusto namin mabayaran talaga para mababaan pa natin yung mga testing na gagawin natin. Lalo na yung mga nagtetest sa ating mga kabayan. There are about over 290, I believe, na nagtetest. Hindi lang kami sa Red Cross. But anyway, to proceed, I'd like to call very, very quickly with the permission of everyone. We shall be very quick here. Senator Bongo has asked because he's been pilloried, and I will allow him. Go ahead, Senator Bongo. Christopher, go. Be very quick. You're being pilloried for your association with Undersecretary Lau. Please proceed and make your repose, and then I will start recognizing all the senators with the permission of everyone. Go ahead.
A good day, Mr. Chair, distinguished colleagues, and to our resource persons in this hearing. I thank Chair Senator Gordon and the Blue Ribbon Committee for conducting this hearing. Mahalaga po ito upang mabigyang linaw ang mga naging obserbasyon ng Commission on Audit sa Department of Health at para mabigyan rin po ng pagkakataon ang DOH na linawin at ipaliwanag ang paggamit ng pondo para sa COVID-19 response. Karapatan ng bawat Pilipino na malaman kung saan napunta at paano nagamit ang pera ng bayan. Mr. Chair, I took time to listen and analyze the discussions in the previous hearing. Now, kindly allow me to share my preliminary comments on the issues raised. First, according to the DOH, more than 379,000 public and private health workers received their special risk allowance or SRA this year. However, some health workers claim they did not receive such allowance. Obviously, there needs to be a reconciliation of the number of health workers eligible to receive the SRA. Dapat i-reconcile ng DOH ang kanilang records sa mga ospital para ma-validate kung sino na ang nakatanggap at sino pa ang dapat makatanggap ng allowance. Nakarating nga rin po sa akin ang concern ng mga resident doctors na hindi rin po sila nakakatanggap ng allowance. Sila naman po ay mga frontliners din na humaharap sa mga pasyente at nagsasakripisyo. Kailangan bigyan din po sila ng allowance. Minsan po wala na sa oras ang kanilang mga pag-duty. Dapat maging proactive ang DOH dahil responsibilidad nila na siguraduhin nakakatanggap ng benepisyo ang mga health workers na frontliners natin ngayon. Inatasan at binigyan na po ng deadline ni Pangulong Duterte ang DOH at DBM sa pag-release ng pondo nang sa gayon ay mabigyan na ang mga health workers ng kanilang mga allowances. Dapat pati rin po yung mga vaccinators natin ay mabigyan po ng sweldo mula Setyembre hanggang Disyembre, hanapan po ng pondo dahil sila naman po ay may tuturing natin mga frontliners at sila po ang kaharap ng tao sa bakunahan. At the same time, nakapagbibigay po tayo ng trabaho, huwag niyo pong sayangin ang panahon dahil alam niyo walang katumbas ang sakripisyo ng ating mga health workers. Likewise, Mr. Chair, I seek clarification from the DOH concerning the unobligated allotments as of December 31, 2020. Habulan po tayo ngayong may health crisis. Dapat magastos ang inyong budget sa tama at mabilis na paraan. Hindi nagkulang ng suporta sa inyo ang Kongreso at maging si Pangulong Duterte. As chairman of the Senate Committee on Health, I have always been fully supportive of the budgetary requirements of the DOH, but I have also been emphasizing to all agencies that they should spend their budget judiciously and prudently. Ito naman pong PhilHealth, mukhang nasobrahan po sa prudence at medyo talagang takot rin po dahil sa nangyaring investigasyon ng mga previous management po, natakot na sila naniniguro na po sila sa ngayon. Ayaw nilang magkakaso at ayaw nilang masuspendido dahil gusto nilang maging stricto. Tama naman po yun. Pero iba po yung panahon ngayon. Dahil gusto nilang isuspend muna ang payment ng mga ospital na may pending investigation. Dapat bigyan ng palugit ang mga ospital. Ang mahalaga naman dito...
Senator Go, with all due respect, I put you on first because you had a pain in that you were being accused unfairly. And I thought I would give you that so that at the very beginning, you can already state your case. But if you're going to talk about what must be done and what needs to be done, I think that will be taken up by the rest of the resource persons as well as the other senators. And it would be unfair for me to give you this time. So please proceed with what we talked about. Go ahead and address the issues that you were telling me when you called me that you were being fairly associated with Undersecretary Lau. Go ahead, please.
Anyway, sir, Mr. Chair, let me finish na lang po since corruption naman po pinag-usapan natin dito. At sabi nga ng Pangulo, gamitin niyo po ang pera basta nasa tama. You should maximize our resources, especially in health emergency. Dapat walang natutulog na pera at walang nasasayang na panahon. If there are inefficiencies, the DOH should ensure that these are resolved immediately. Nasa gitna po tayo ng pandemya at hindi pwedeng papatay-patay ang gobyerno. Hindi rin tayo papayag na mayroong overprice at lalong-lalo na po na may anomalya. Every single peso should be not wasted or worse, stolen. Pera po ng taong bayan yan, dapat sila po ang makabenepisyo dyan. That is why I give my full support to the inquiry on the alleged overprice of face mask and face shield. I am one with the chairman and my colleagues in ensuring no funds are lost to corruption. Silipin natin ang dapat silipin natin upang lumabas ang katotohanan at magkaroon po ng kaliwanagan ang mga issue. Yun rin po ang pinangako ni Pangulong Duterte noon. Wala kaming pinapalampas. Kahit sino ka man, kahit saan ka man nanggaling, basta napatunayan na sangkot ka sa korupsyon, dapat kang managot. Nakikiusap po ako sa COA at Ombudsman. I urge COA and Ombudsman to audit and investigate not only DOH and DBM, but all government agencies para matigil na po ang haka-haka. Dahil unfair naman po ito sa mga nagtatrabaho ng matino. Na nadadawit po base sa mga obserbasyon pa lamang, may proseso tayong dapat sundin. Hindi po tayo papayag na masayang ang oras at pagod ng mga nagtatrabaho ng maayos sa gobyerno dahil lang sa mga haka-haka at intriga. Kailangan mapatunayan na may anomalya. Kung mayroon man, para makasuha na agad at makulong ang sino mang may sala. Mismong si Pangulong Duterte po ayaw ng katiwalian sa gobyerno. Kung may nakita tayong anomalya, kalokohan, overpricing, kasuhan na agad at ikulong para makapokus na po tayo sa trabaho at sa totoong kalaban natin ang COVID-19. While we are focused on COVID-19, that does not mean we lose sight of other battles. This administration has promised to overcome the battle against illegal drugs, criminality, and corruption. Anyway, Mr. Chair, allow me to take this opportunity to set the record straight. Sinasali nila yung pangalan ko. My name was unfairly dragged dito po kay Undersecretary Lau ng DBM na sinasabing serve as my aide. Kailanman ay hindi ko naging aide si Yusek Lau. He was appointed to the presidential management staff at the start of President Duterte's term until early 2017, after which he was appointed to the HULRB and later to the DBM in 2019. Before resigning last June of this year, Yusek Lau did not directly report to me, nor did he ever serve as my aide. I already assumed my post in July 2019 as an elected senator when Lau was designated to head the PSDBM in August 2019. He was never part of my office, the Special Assistant of the President's organizational structure, as PMS is directly reporting to the office of the President. As Special Assistant to the President, I merely exercise oversight over the office of the Appointment Secretary and the Presidential Management Staff. Among others, I was not involved in the day-to-day operations and management of Laos Office. Limitado ang aking oversight function sa pagsisigurong na ipapatupad ang mga sistema at proseso. May sarili-sarili silang head kung saan sila nagre-report. Napakalaki po ng opisina dyan sa Malacanang. Ito ang dahilan kung bakit ko nasabing hindi ko naging aide kailanman si Lau. Hindi ibig sabihin na porket nakatrabaho mo na siya dulot ng aking oversight function, ay naging aide ko na agad. Iba ang aide, iba ang nakatrabaho. Lahat na nagre-report sa Malacanang compound noon ay katrabaho ko po. Pero hindi ibig sabihin na naging aide ko rin ang ilang libong empleyado doon. Nonetheless, kung may korupsyon o anomalyang mapatunayan, ay dapat mananagot ang salarin. Yan ang isa sa pangunahing campaign promise ng Pangulong Duterte, campaign against illegal drugs, criminality, and corruption. Kahit sino ka man, kahit saan ka man ang galing, kahit tumulong ka pa noong eleksyon kay Pangulong Duterte, kapag pumasok ka sa korupsyon, yari ka talaga. Ang pangunahing bilin ng Pangulo sa kanyang inappoint, just do what is right and avoid corruption. Pag ginawa mo ang tama at inuuna mo ang interes ng mga Pilipino, suportado ka namin. Tuloy-tuloy lang at hindi po titigil ang kampanya namin ni Pangulong Duterte laban sa korupsyon. Whether I like it or not, iisa lang kami ni Pangulo, iisa ang hangarin namin sa Pilipinas at parehas ang aming prinsipyo. Even a mere whip of corruption, kahit sino ka pa, walang lugar sa amin ni Pangulong Duterte ang korupsyon at katiwalian sa gobyerno. Pareho kaming galit sa mga magnanakaw, masagasaan na po ang dapat masagasaan, wala kaming pakialam.
Senator Go, you have 1 minute to wrap up because other senators have a right to their 10 minutes as well.
Sorry Mr. Chairman, maraming na-appoint ang Pangulo na taga Davao, pero ito ay dahil kilala sila ng Pangulo. Kaya may tiwala sa kanila at alam ang kanilang kakayahan. Pero kahit na may utang na loob si Pangulo sa inyo, wala po sa usapan ng korupsyon. Kasi ang gusto ko talagang tumulong, kung gusto mo talagang tumulong sa administrasyon, gawin mo lang po ang tama. Patuloy ako maging tulay kay Pangulong Duterte kung may reklamo at haka-haka, may intriga, may proseso naman po ang executive branch para imbestigahan ang sino mang gumawa ng korupsyon. Binibigyan ng halaga ni Pangulong Duterte ang lahat ng reklamo. To end, Mr. Chair, gusto ko pong ipaalala sa ating mga ahensya na bawat araw, bawat oras, bawat minuto, bawat piso ay mahalaga dahil habulan po ang laban na ito. Nanawagan po ako sa inyo. Alam ko po, hirap na po kayo sa DOH. Huwag niyo pong sayangin ang inyong sakripisyo. I hope the discussions in this hearing will lead to a positive outcome and fruitful resolution of the issues, particularly on the payment of allowances to our health workers and the improvement of utilization of funds of the DOH. Dahil kawawa po ang Pilipino. Sila po ang nagmamakawa sa tulong ng gobyerno. Kung may kakulangan man po, iwasto po kagad. Klaruhin po ang dapat klaruhin, mabayaran po ang hindi pa po nabayaran. Ang obligated funds, sana ay magastos rin po sa tama. Walang dapat masayang na oras at pondo. Pagbutihin niyo po ang inyong trabaho po. Maraming salamat, especially in times of crisis.
The chair now recognizes, thank you for your remarks. Thank you. And the chair now recognizes the majority floor leader, after which the chair, if you're going to ask questions or you want a preliminary statement, the preliminary statement should be limited to at least 1 or 2 minutes. And then, we have until only up to 2:30 to finish this. So I hope you don't mind that we finish this as quickly as we can and be direct to the point. So, Senator Zubiri, you have 2 minutes to make your preliminary statement. Unless you want to do it later on, you have 10 minutes later on.
If I may take up my 2 minutes, Mr. Chairman, because it's a different topic altogether with the resolution that I filed yesterday. The other day, Resolution 858. So basically, I will just lay the predicate of my questions later. Really quick, 2 minutes. Okay, thank you, Mr. Chairman.
I appreciate your cooperation, and now we recognize the minority floor leader if he has any preliminary statement to make.
Mr. President, Mr. Chairman, I had a preliminary statement to make just for 2 minutes.
All right, okay, go ahead.
Okay. Thank you. Mr. Chairman, since the pandemic began, our healthcare workers had no reprieve. They're overworked. And alam naman po natin ay may problema din tayo sa SRA, Special Risk Allowance, and unpaid health claims. Umabot na nga yung mga kaso to 18,000 a day. The problem really is we need to roll out and mapalawak po natin ang ating vaccination drive. At meron tayong multi-party agreements with LGUs and private groups looking to procure and even administer their own vaccines at absolutely no cost to the government. I even had a meeting with Ambassador Kumaran of India last Monday, and I was amazed to hear how India dealt with their surge back in April and May. From a high of 400,000 cases a day, sila po yung nasa laman ng CNN at lahat ng international news. At nakita po natin yung crisis sa India na mga tao ay nasa labas na ng mga kalsada at hindi makapasok sa ospital. But amazingly, they had managed their crisis with an aggressive vaccination campaign that has averaged to about 5 to 8 million doses daily administered to their people. They have now close to 570 million people vaccinated with one dose, and 150 million people are fully vaccinated. And their cases are now very manageable to about 25,000 to 30,000 a day. Imagine from 400,000 a day, binaba po nila ng 30,000 a day, which is a big drop for a country of 1.3 billion people. The ambassador credits it to the vaccination drive. And also using two vaccines, primarily the Covishield, which is the same as AstraZeneca, made by the Serum Institute of India, and Covaxin by Bharat Biotech. And they have found out that in some states, they've already vaccinated 50% of the population with one dose. And the fatality rate, Mr. Chairman, is now 1%. Yan pong gusto natin mangyari dito para matapos ng pandemya at mabawasan naman yung araw-araw pagod at peligro ng hinaharap ng ating healthcare workers. Kaya umaapela po kami sa national government and IATF na kung pwede bigyan po ng paliwanag itong rason na hindi pa napipirmahan ng IATF ang multi-party resolutions. I've been in dialogue with Secretary Galvez and Secretary Dizon. They have explained to me their situation, and we asked them to present this for the record in this committee so that we may be informed on what the plans of government are para mapalawak po natin ang ating vaccination drive. So, yun lang po, Mr. Chairman, at maraming salamat sa panahon na binigay mo sa akin. Thank you, sir.
Thank you for being on time. Thank you. Appreciate it. Now, I call on the Minority Floor Leader, the Honorable Senator Franklin Dillon. Is it going to be a preliminary statement, Mr. Minority Floor Leader, or is it going to be part of your 10 minutes already?
No, I'll just go to the questions. No opening statement.
All right, so your 10 minutes has begun.
Thank you very much, Mr. Chairman. First, I direct this question to Secretary Duque. Can you confirm that the total allotment of the Department of Health's COVID-19 response is 77,879,262,584 pesos? Can you confirm that? We don't hear anything, sir.
Senator
May we
Duque,
request
you there, please?
Can you hear me now, Mr. Chairman?
Yes, go ahead, please.
Okay. The Bayanihan 1 allotment to the DOH is 52.4 billion, while the Bayanihan 2 allotment is 50.8 billion. So all told, this would be about 203 billion, thereabouts, Mr. Chairman.
How much? Would you mind, Mr. Chair, if I ask Secretary Duque to remove his mask? We could hardly understand it from this end.
Yes. So, let me make that instruction to everybody. When you speak, move away or let the others move away from you so that you can be helpful, and take off your mask so we can see your face and you can have a clear voice. Go ahead.
So just to reconfirm, what is the total allotment of the Department of Health just for COVID-19 response, excluding the vaccines cost?
The data from our financial management service is that Bayanihan 1 allotment is 52.4 billion, while the Bayanihan 2 allotment is 50.8 billion. So all told, this would be about 103 billion, thereabouts, Mr. Chairman.
103 billion.
Yes. For a more detailed explanation, may I please request Mr. Chairman to recognize Director Rowena Lora. Thank you, Mr. Chairman.
I don't need that at this point. I just to establish the total allotment. I'll take the word of the Secretary. It's 103 billion. Now, it's of record that COA made a management deficiency findings on 67.3 billion, just to round it off. And the biggest chunk of the 67.3 billion mismanaged fund is the according to COA, is the 42 billion undocumented transfers to PSDBM. According to COA, these were not supported with complete documentary requirements, contrary to law and regulation, and casted doubts on the validity, regularity, and propriety of this action. So the first question that we have, Mr. President, is why did we transfer 42 billion for COVID to PSDBM as found by COA? Again, we could not hear anything, sir, with your
Hear me now, Mr. Chairman? I think there's, yeah, what about now, Mr. Chairman?
Yes, now I can hear you, sir.
Okay, thank you, sir. Yung pong DOH ay naglipat ng pondo sa procurement service ng kagawaran ng budget at pamamahala o DBM upang makabili ng common use supplies and equipment bunsod ng mga sumusunod na detalye. Una, sa panimula ng pandemya, ang DOH ay namahala sa pagbili ng personal protective equipment gaya ng N95 masks, surgical masks at iba pa upang mapalitan ang nauubos na supply ng taunang inventory ng PPE nang ipinamahagi ang mga ito nung kasagsagan ng pagresponde sa pagputok ng Bulkang Taal noong January 2020. Pangalawa po, noong February 2020, nang magsimulang lumaganap ang COVID-19 at unting-unting dumami ang naitalang kaso, ang DOH po ay nangailangan dagdagan ang PPE supplies para sa pampubliko at pribadong health facilities. Sinubukan nito na mag-bid sa pamamagitan ng amin mismong Central Office Bids and Awards Committee or COBAC nito. Ngunit bigo itong magkaroon ng bidders na kakayanin ang dami ng nangangailangan o volume, bunga na rin po ng limitadong supply sa merkado, maging ang itinakdang kalidad ng PPEs na nais mabili ng DOH. Ang mga bansa po naman ay gumagawa ng PPEs ay nagsimula rin limitahan at ireserba ang kanilang mga supplies para po sa kanilang sariling pagkakagamitan habang ang demand ay patuloy na tumataas at hindi patas ang production capacities po ng mga bansa. Pangatlo po, sa mga unang buwan ng pandemya, ang DOH ay nagsumikap na suyurin ang lahat ng kaparaanan upang makuha po ang mga COVID-19 response commodities. Nang sa gayon ay matiyak ang tuloy-tuloy at sapat na PPE para po sa mga health workers sa magkasabay na pagkakataon. Ang inyo pong DOH ay bumili ng pamamagitan ng Bids and Awards Committee habang pinoproseso din ang pagbili ng pamamagitan ng ibang procuring agency, kagaya po ng PSDBM. Ginawa po ito upang masiguro ang sapat na PPE supply sa gitna po ng pagdaigdigan kakulangan nito. At sa gitna po ng state of public health emergency, Your Honors, minarapat po.
Secretary, can we can we just answer the questions we ask rather than go through all of this? And I will be very brief. My time is limited. Question: Is there propriety of in PSDBM procuring these items for the DOH? From the listing of the procured items, it would appear that the DOH is better equipped to handle these purchases of surgical masks, surgical shield, facial mask, facial shield, etc. I repeat the question. Should the DOH do the procurement itself since it is more specialized? These are medical needs. Hindi ba dapat ang DOH, mayroon po kayong Bids and Awards Committee. Why was it not handled by DOH?
Mr. Chairman, gaya po ng sinabi ko, meron din po kaming mga pinocure using our own back. You are right. We also did procure. But owing to the required volume, hindi po namin kakayanin dahil kakaunti lang po yung amin na komite ng bids and awards, no? And meron din po kaming mga programa pa na non-COVID, ang dami-dami mong programa ng Department of Health at kanya punong-puno na po yung tungkulin ng ating pong mga internal bid and awards committee. So we needed help, Mr. Chairman, and there was a GPPB resolution actually to say and to state that all these supplies have been considered as among the common use supplies and equipment. Thank you, Mr. Chairman.
Thank you very much, Mr. Chairman. Now, to your knowledge, Mr. Duque, were these procured agencies materials in the inventory of PSDBM?
Yes, Mr. Chairman. What I know is majority of these are included in the GPPB resolution identifying them as common use supplies and equipment.
That's not my question. My question is, to your knowledge, are these items that you sought to procure in the inventory of PSDBM? Given the volumes?
Yes.
Not.
Yes, Your Honor. Yes, Your Honor.
It's not in the inventory. It is not in the inventory of
No, most
PSDBM.
of them. They're most of them. Yes, they are. Most of them are in the inventory of the PSDBM, Your Honor.
You mean the 42 billion worth or whatever is the equipment and face masks, face shields, etc. Was this in the inventory of PSDBM? Can you ask your people again?
Yes,
maybe if Mr. Lau is here, you can ask Mr. Lau. I doubt it for your answer. You're saying that all of these 42 billion worth of procurement is in the inventory of DBM, PS. Yes, with your chairman, may we ask Secretary Lau?
Lloyd Christopher Lau, Your Honors. Before the declaration of the medical items classification as CSE, these items were not part of the inventory of the CVM except for alcohol and some sanitizing items.
Yes,
I think the surgical mask, the face shield.
So it was not part. It was not part of the inventory
before the declaration of these
before
items.
The declaration,
yes.
It was not part now.
Yes.
And therefore, you are what DOH did was to secure the services of PSDBM as a procuring agency, not as a not selling your inventory as you did for ball pens, etc.
After it was declared as common supplies, Mr. Chair, then that's the time that they requested PSDBM to procure. Because if there is no declaration that these items are common supplies, then you cannot buy it directly from us until there is a memorandum of agreement. So if such items would have not been declared by GPPB as common supplies, then there should be a memorandum of agreement when they procured. However, I think when they transferred the funds, it was already declared as common supplies, Mr. Chair.
The fact is, since you did not have these medical items in your inventory, there was a request from DOH to procure it. Is that
Yes,
correct?
Mr. Chair.
All right.
Yes.
Having said that, so now, are you aware that under the implementing rules and regulations of the Procurement Act, specifically paragraph 7.3.3, this is the implementing rules and regulations. And let me read it for the record. In order to hasten project implementation, procuring entities which may not have the proficiency or capability to undertake a particular procurement as determined by the head of the procuring aid concerned may outsource the procurement task by letter A, requesting other GOP agencies to undertake such procurement for them through the execution of a memorandum of agreement containing the specific arrangement, stipulations, and covenants in accordance with government budgeting, accounting, and auditing rules. In this particular case, you are a procuring procuring these items, 42 billion at that, for the DOH. Why was a memorandum of agreement not signed in violation of the implementing rules?
During that time, Mr. Chair, when they were discussing with us, PSDBM has already been authorized by GPPB to procure these items because these items were already considered as common supplies.
Procuring the item is different from requiring an MOA. I am asking you specifically, why was there no memorandum of agreement signed?
Yes, there is no need for a memorandum of agreement if the items that are being procured at to PSDBM are considered common supplies. These items during the time were already declared as common supplies, Mr. Chair.
I am sorry, but what you're saying is contrary to the implementing rules and regulations of the Procurement Act. There is nothing there which dispenses with the memorandum, with the execution of a memorandum of agreement, which is necessary so that there can be a documentary tracing of this disbursement. 42 billion. By the way, according to the former Secretary of Health, kayang-kaya po yung 42 billion procurement. Hindi po tama ang sasabihin nyo, Secretary Duque, na walang kakayahan ang Department of Health. According to your predecessor, I won't mention who, but kayang-kaya ng Bids and Awards Committee ng DOH. Can you...
Mr. Chairman, yung PSDBM kasi, meron po silang kakayahan na mag-angkat ng mga supplies from international suppliers. Pangalawa po, ang DOH talagang very limited ang kanila pong Bids and Awards Committee to process all the procurement requirement of the DOH. Kanya, ang approach po namin is whole of government. Kanya naman po minabuti namin na humingi ng tulong sa PSDBM dahil unang-una kulang na kulang din ang mga supplies. Ano po? Talagang
Secretary Duque, prudence would have dictated that when you transfer 42 billion to another agency out of the budget of DOH, you should have signed a memorandum of agreement. Is that a prudent thing to do for a secretary? 42 billion is no small money. Couldn't you sign something with or the memorandum of agreement with the PSDBM?
Yes, Mr. Chairman, if I may just respectfully request USEC Roger Tong-An to please give his rejoinder to your question. Thank you, Mr. Chairman.
I'm asking the Secretary, Mr. Chairman, prudence would require that when you move 42 billion of your budget to another agency, a memorandum or some document should be signed to cover that transfer. Is that not correct?
We have a document to cover the transfer, which is known as the agency procurement request. And also, I would like to state for the record that the execution of the MOA was not required to the fund transfer transactions with the PSDBM, since it covers, as was underscored, already considered as common use supplies in the aforesaid GPPB resolution and banking on the provisions of other relevant legal basis. I will submit to you, Your Honor, the section the section 53.5, 2016 IRR of RA 9184, agency to agency, procurement of goods, infrastructure projects, and consulting services from another agency of the government of the Philippines, such as PSDBM, which is tasked with the centralized procurement of common use supplies for the GOP in accordance with the letters of instruction number 755 and EO 359 series of 1989. So yung section 20 of the 2020 General Appropriations Act, nakalagay naman po, procurement of common use supplies, all agencies of the government shall purchase its common use supplies requirements from procurement service as mandated under LOI number 755 dated October 18, 1978, EO number 359 series of 1989, and AO...
Secretary Duque,
yes, sir.
fond of reading kilometric statements. I just ask you a simple question. In your judgment, there was it was not necessary. The prudence does not necessarily dictate that you sign a document when you move 42 billion from your department to the DBM. There is nothing wrong with that, in your view.
Yes, Your Honor, you are right, Your Honor. But however, with the findings of the COA, we have agreed that with their guidance, we can still actually come up with the memorandum of agreement, as this is one of the deficiencies that was reported, and we are given 60 days within which to correct those deficiencies, Your Honor.
All right. Now, of the 42 billion, more or less, that for the procurement of COVID-19 supplies and equipment, according to the COA, only 28.870 billion was disbursed as of December 2020. Would you confirm that, and that therefore there is 12.93 billion which was unused and disbursed?
Your Honor, may I please request the chair to recognize Director Rowena Lora for the specifics of the numbers. Thank you. Director Rowena Lora may be recognized by the chair.
Can your director simply confirm that 12.93 billion was undisbursed?
Good morning, Your Honor. Yes, may I be recognized? This is Director Rowena Lora of the Central Office, Department of Health, sir.
Go ahead, ma'am.
With regards to your question, sir, I think there are some disparity with the figures. With the report of PSDBM as of June 30, they have already awarded 39 billion out of the 41 billion we have transferred as of December 31, sir. And with regards to delivery, sir, per accounting section of the PSDBM, reported that they have already deliveries of 31 billion out of this 41 billion. However, sir, the documents of which is still for forwarding to the Department of Health. Thank you, sir. Thank you, Your Honor.
Yes. Can you please remove your mask so we can understand you better? Thank you very much, ma'am. So, question: you're saying that
Senator Rilon, excuse me. I would like the lady who answered to state her name, because I do not know who she is. It says AFMT. Could you identify yourself? Because I'm taking notes here.
Yes, sir, Your Honor. I am Rowena Lora of the Department of Health, Financial and Management Service.
Aura.
Laura.
Okay.
Laura, okay, thank you.
Yes, Your Honor.
Let us make that SOP because anytime we speak, you please state your name so that we can follow you properly. Go ahead, please, Senator Duran. I apologize.
Thank you very much, sir. Now, in other words, you're saying, ma'am, that while the COA found as of December 2020 that 12.3 billion was undisbursed from the DOH funds with with PSDBM, this was already disbursed as of June 30? Are you saying that?
The correct term that we are using, sir, is utilize, sir. Utilize meaning, what I have mentioned is from the records of the DBM, PSDBM accounting section, 39 billion of the 41 billion we have transferred were already awarded or utilized.
That is of June 30, as of June 30.
Yes, sir.
So you can, okay, as of June 30 now.
Yun pong na-mention sa COA, sir, na report, it might be the recorded deliveries, official recorded deliveries in the books of accounts of the Department of Health. Di po talaga po pa nakukumpleto yung mga dokumento. There might be physical deliveries, sir, on site. Parating pa lang po yung mga dokumento and for review pa rin po ng aming supply chain management office and for forward po sa accounting office po ng Department of Health to book it up as reported deliveries or liquidation of the PSDBM, sir.
Well, okay, so would you confirm that these supplies are in the warehouses of DOH?
Confirm that figure, sir, if at the time of December 31, it is still in the Department of Health warehouse since some of the items were directly delivered to the recipient health units.
Okay,
Thank you
okay.
po.
Thank you. Apart from the 42 or so billion that that DOH transferred to PSDBM, the DOH also has an obligated COVID-19 allotment of almost 12 billion. Is that correct? Per COA findings?
For the COA report, sir, the Department of Health incurred around 11.8 billion unobligated allotment as of December 31 for COVID-19 funds. However, sir, as we have communicated both to the House of Representatives and to the Senate office po, adjusted po ito. Meron po kaming final report. Nagkaroon po kasi ng timing difference between the finalization of COA report and yung pinaka-final report po ng Financial Accountability Report of the DOH. So if you will allow me, Your Honor, to run down the breakdown of that 11.89 billion.
Go ahead, go ahead.
Okay, sir. The 11.89 billion po, as corrected, is supposed to be 10.8 billion. Mayroon pong 1 billion na nakasama na dapat na as obligated for year 2020 and it is duly noted to the reports we submitted to the DBM. So, ang natira lang po is continuing appropriation under the GOP of 5.1 billion and then we have the foreign loans of 4.7 billion and then po meron pong of course naglaps po na 1 billion. So yun po yung rundown ng 10.8 billion.
Let me just go to some specifics. Part of the 10.8 billion would be a 975 million unobligated funds for the implementation of Bayanihan 1. Would you confirm that?
Yes.
All right. So 388 million, which was unspent, was for the hiring of emergency workers for the COVID-19 response. Is that confirmed by the COA report?
Yes, Your Honor.
Yes.
Yes, Your Honor.
Now, another 764 million was unobligated and unspent for the hiring of human resource for the health personnel of the DOH, according to COA. Is that correct?
Yes, sir.
Now, another 2.6 billion for continuous COVID-19 laboratory testing services and the hiring of human resources for health personnel was unspent and unobligated. Is that correct?
Sir, still talking about the 11.8 billion, or are
Yes,
you
that's
talking
correct.
about?
Yes. As of December 30, 2020. For the COA.
It might be, sir. Wala po kasi, pasensya na po, sir, pero po yung nandito po kasi.
I'm reading out of the COA's report.
Thank you, sir.
Okay. Another 2.6 billion was unobligated and unspent for the continuous COVID-19 laboratory testing services and the hiring of human resources for health personnel. Another 1.3 billion for the Philippine COVID-19 Emergency Response Project and 3.4 billion for the procurement of vaccines and related expenditure. These are huge amounts of monies which remained idle per COA findings and unobligated and unspent.
Yes, Your Honor, tama po yun. Yung huli niyo pong mga na-mention is under the foreign loans po of World Bank and ADB. As I have mentioned po, ang total po na foreign loans na hindi po nagamit noong 2020 ay 4.7 billion, Your Honor. Tama po yun, kasama po dun yung pambilisana ng bakuna.
Excuse me, Senator Frank. You have 1 minute. I have actually extended you already, but you have 1 more minute. Go ahead.
Thank you very much, sir. Now, other than the PSDBM, were there other entities to which was the receiving entity for the 42 billion that was transferred? Can you confirm that transfer to the PSDBM is 41.6 billion according to the COA?
Sir, for the PSDBM as of December 31, 2020, total po na na-transfer sa PSDBM for COVID po is 41,463,867,117 pesos po. Then, sir,
Thank you. For the PITC, for the
Yes, sir.
PITC, DOH transferred 659,555,409 pesos. Is that correct?
Sir, if I may allow, sir, sa PITC po, 659 po lahat yung inallow ng DOH to be procured for the COVID response. However, sir, 202,971,809 pesos po doon ay nasa PITC na po yun at that time. Yung po sana yung mga natirang balanse or savings sa mga procurement ng mga nakaraang taon na na-freed up na po, like I think it's for the Zika virus. Yun po yung 202 million. And then, bali po, ang na-transfer lang po na talaga po nung December 31, 456 million.
All right. Senator Drilon, I will allow follow-ups to your question, pero briefly, I can see Senator Lacson raising his hand. Go ahead, Senator Lacson.
Yes, with the permission of Senator Drilon, very quick interjection to pursue his point on the GPPB resolution.
Yes, sir.
Thank you, sir.
Yes, sir.
I have here a list of the items included in the GPPB resolution dated March 2020, no? And this does not include face shields. So I wonder where PSDBM got their authorization to bid out the procurement of face shields, because it is not included in the list of the items. As you can see, this is a complete list. Now there's a subsequent resolution or an IRR dated March 31, 2021. I think it is a generalization of items to be procured by as common use supplies and equipment. as categorized. So I wonder what authority did PSDBM have in bidding out or procuring face shields? Because face shields, as you can see on the screen, hindi po kasama doon sa listahan. So with or without MOA or with or without GPTB resolution to that effect, PSDBM is not authorized or was not authorized at the time to procure face shields because wala po sa listahan. Thank you, Mr. Chairman. Thank you, Senator Drilon.
Point is well taken.
Just to add to Senator Lacson statement, sir, just one point. There is also listed as a common use supplies and equipment the extraction machine, as Senator Lacson pointed out. There is an extraction machine and a mechanical ventilators, 1,500 units at 1.3 billion. Hindi po kasama yan sa listahan na pinakita ni Senator Lacson. So how do we justify this? Thank you very much, Mr. Chair. And that's my last question.
Thank you. Is there an answer? Did you ask a question, Senator Drilon?
Yes, the question is, and I'm consistent with the question of Senator Lacson, where he said that there are the face mask and face shields are not part of it. I am also adding
about
that
the
extraction machine
That's
is
correct.
not
That's
part
heavy.
of that, yet was purchased, and mechanical ventilators was purchased, and yet it was not part of the classification of common use supplies and equipment, and the medical ventilators amount to 1.35 billion.
The observation is noted by the chair. And before I call the next thing, I just have two follow-up questions in connection with the questions of Senator Drilon, with Senator Drilon's permission, of course. Number one, the rules say that the general rule, para maintindihan ng ating mga nakikinig at nanonood, ay ang bibili talaga, nagpo-procure ang procurement system ng DBM ng mga common use para pagka may gamit, magagamit kagad. Kaya mayroon kayong 11 bodega. Tama po ba yun, Secretary Feld? You're on mute, sir.
Again, Mr. Chairman, Yusek Carol Taino to be
The provisions of the Executive Order 359 says that ang general rule for the benefit of the public, DBM, ginawa niyan noong 1989, no? Para lahat ng mga bibilihin ay naandyan nakabukod. Kaya naglagay pa kayo ng 11 bodega all over the country. Bukod pa sa bodega ng DOH, may bodega pa ang DBM. Is that correct?
Yes, I think that's right, Mr. Chairman.
So having said that, ang general rule, bibili sila dahil baka para hindi nabibigla ang gobyerno at para na-take advantage yung bulk purchase, makakadiskwento. Tama po ba yan?
Yes, Your Honor. May I request, since you're asking for DBM's warehouses, maybe Yusek Lau will be the best person to respond. Thank you,
Yusek Lau is
Mr.
no
Chairman.
longer in the government. I will ask the DBM person. Who is
Mr.
the DBM?
Chair,
Yes.
Mr. Chair,
Sandali lang, Risa, sandali lang. Senator Tiveros. Where is the DBM secretary or undersecretary?
Mr. Chair, am I the one being asked?
Your Honor, but I think Yusek Lau is in a better position to respond to where our depots are.
No. He's a civilian right now. I will task him on the matters that were taken up during his time. But my question is, you ought to know that because we don't pass it on to our subordinates. A secretary must know you have warehouses, correct? 11.
Yes, Your Honor. These are for the regions, our regions.
So that when you buy, you spread it throughout the warehouses. So madaling ipadala kagad, correct?
Yes, Your
Everything
Honor.
from coupon band, from mga common use na ginagamit, correct?
Yes, Your Honor.
Now, let me now ask, hindi ba ang general rule kayo ang bibili? Pero nakalagay rin dito sa section 3 nito na pagka may emergency, the agencies are however allowed to procure directly for emergency needs. Now, bago dumating itong emergency ito, Secretary Duque, meron bang nakalagay sa bodega? Ngayon tatanungin ko na si Undersecretary Lau. Meron bang nakalagay kayo sa mga bodega nyo no mga common use na sinasabi mo?
Some items we were able to.
Sagutin mo yung tanong ko, ano some items? Meron kayong, ilagay nyo listahan. Meron kayong face mask?
We were able to procure.
No, I'm not asking you what you procured. Makinig ka sa tanong.
I apologize.
I'm asking you, alcohol, meron kayo?
Yes, we have alcohol. We have the tissues.
Sanitizers, tissue?
Yes, Mr. Chair. The common things that we have are the.
Kaya, so meron kayo.
Yes, Mr. Chair.
Alright, kaya nagkaroon tayo ng emergency ngayon.
Yes, Mr. Chair.
And under the law, unang-una, primary jurisdiction should belong to the Department of Health, as far as I'm concerned, my reading, because they know what is best for the health needs of the country. Would you agree with that? You're a lawyer.
Yes, Mr. Chair.
You agree with that? Good. Now, that's why the law says, yung AO 359, nakalagay dyan, pagka may emergencies, papasok agad ang agency concerned. May kakayahan, tama yung tanong kanina ni Senator Dillon, Secretary Duque, na may kakayahan kayo, meron kayong procurement services dyan, kahit na pa may pandemya, hindi nawawala yung procurement service nyo, hindi nawawala yung back ninyo. Tama po ba yan?
Yes, Mr. Chair.
At tama po kayo, Mr. Chairman.
I have to be fast because I don't have enough, I want to have the others to have time. So that means, hindi niyo nagamit yung mga bodega dahil nagdagdag pa kayo ng order. Siyempre, dumami, di ba? Mag-o-order kayo. At dyan nagkakaroon ng taas ng kilay ng mga mamamayan natin sapagkat bulto-bulto, bilyon-bilyon ang binibili. Now, Undersecretary Lau, magkano ang binili nyo between the period that you started? March. Kailan kayo nagsimula? February or March?
March po. We started procuring starting March, Mr. Chair.
Anong date?
March 20 was the first procurement that we had.
Anong procure nyo?
Face mask po, Mr. Chair.
Face mask. Nagbiling kayo dyan?
Yes po. We procured it at 16 pesos.
16 pesos, ha?
Yes.
Remember, you're under oath. I just authored the perjury law. Pag na-approve yan, you're a government entity employee at that time, we can get as much as a life imprisonment.
Yes, Mr. Chair. This is supported by record.
Okay.
Then, April.
I asked you for those records, but we did not get it, right, Mr. Kimbo? Hindi nagsambit ang DBM ng mga records na yan.
Yes, Your Honor. So far. Yes, Your Honor, so far.
So that means you're already in violation of the lawful orders of the Blue Ribbon. Dapat nagsambit ang DBM.
I apologize, Mr. Chair. I am no longer connected, so I cannot.
Oh, yan. Kaya hinuhuli lang kita. Saligurado, sasagutin mo yan kaya hindi kita tinatanong Oh, yung secretary, yung the real secretary now. Di ba hiningan namin kayo ng records niyo? Paano kami makakapagtanong na matino kung hindi niyo bibigay yung records niyo?
I gave instructions already, Your Honor, because it was forwarded to us Monday afternoon with no summary. So we provided the summaries because it was around, I think, 20 thick envelopes, if I'm not mistaken. I'm not very sure about the number. So, but we've provided it this morning, if I'm not mistaken. Opo.
That's really nice of you. This morning, and the hearing is at 10 o'clock in the morning. But anyway, we can deal with that later. So, nag-bid kayo, tapos ano second bid nyo? Kailan? You're on mute, sir.
April 6, 2020, we had it at 27.49, the lowest. Then at April, we had it at 27.
Kano kalaga ng bid nyo noong April 6?
27.49 pesos. Then
No, hindi ko tinatanong yung presyo. Tinatanong ko yung halaga ng bid. Magkano ang
Okay.
total amount? 1 billion? 2 billion? 3 billion?
March 20, 2020 at 16 pesos with a total amount of 800,000 pesos. Then on April 6,
Ang
2020,
total amount ng bid,
yes po, it's 800,000 pesos at 16 pesos per piece.
800,000.
Yes, then on April 6, it was at 100,000 pieces at 27.49. Then another 500,000 pieces at 27.72 with a total amount of 13,860,000 on April 6, 2020. Then on all April 14, we bought 2.4 million pieces at 54 million with a cost of 22.50 centavo per piece. On April 16, we bought it at 22.50 with total amount of 6,750,000.
Okay, I will not let you waste the time of the committee. Director General is instructed to get those documents and make it available to every senator by way of email.
Yes, Your Honor.
Senador yan.
Yes,
Para
Your Honor.
matanong kayo. Alright?
Mr.
Yes, Your
Chair.
Honor.
May we be allowed to give some statement? We were able to procure it at 13.50, and when the economy was very strong and we had sufficient supply already, we were able to procure it at 1 peso and 49 cents.
Well, I'm not asking that question. All I'm asking is bulto-bulto. Di ba totoo? I will go later on. Remember, we do our homework here. Kahit hindi kayo magbigay, makakakuha ko ng dokumento. Di ba totoo? May mga bid kayo, 1 billion per bidding?
Hindi po. We were able
do not lie.
No po. Sa surgical mask, wala po.
Hindi sa mask. Meron kayo sa PPE. Sabay-sabay.
Yes.
At ang binigay nyo, in-split pa ninyo yung bidding ng 1 billion.
Sa PPE po, we were able to bid it. I don't have the data. Yes, kasi yung PPEs kasi...
Okay, I will forgive you on that, but I want that data because just answer my question. Meron kayong billion-billion na binibid, right?
Yes, with respect to...
Binibigay mo sa akin yung kuto eh. Bigay mo sa akin yung dinosaur.
Yes, yung sets po we have. I think the records it with PSDBM. Yes, sir. Kasi meron tayo...
Yusek, will you please make sure that we get it now? Andiyan kayo sa opisina nyo. Ipa-email nyo na sa amin yan at para maganda itong investigasyon para makapaghanda kami appropriately. Pero totoo yung sinasabi ko, Yusek Lau.
Yes,
Ikaw ang Yusek ng araw. Hindi kita dinidiin, ha? Binabigyan kita makapagpaliwanag. At binibigay mo sa akin yung itong presyo, mababa pa noon, biglang tumaas. Hindi ko tinatanong yan. Ang tinatanong ko muna, bilyon-bilyon ang nabibid nyo at one time at kung magkamisan, may mga nagpo-protesta. Totoo o hindi?
That's accurate, Mr. Chair.
Accurate. Okay. Ibig sabihin, pagka bilyon-bilyon, naghahati-hati, nagkakaroon tayo ng problema.
Ano po, Mr. Chair?
Kakaroon tayo ng problema. Anyway, hindi na. Ako nang bahala doon later on. So, yun lang. So, ibig sabihin, just to clarify, Mr. Secretary Duque, at totoo niyan, pagka may emergency katulad dito, you can actually do the bidding yourself. Especially ito, mga face mask. Dapat may tao kayo dyan eh. Tulad dyan, at kakansyawa kayo, face shield. Anong malay ng DBM doon sa extraction kung tama yung binibili nila? Ang nangihingi, ang Department of Health. Kayo ang nagre-request na mag-bidding, na kahit na wala sa listahan, nag-bid yung DBM, PS. Is that correct?
Mr. Chairman, we provide the PSDBM all the technical specifications because sa amin manggagaling yung technical specs.
Okay. All right. I believe you. But narinig mo yung sinabi ni Senator Lacson, narinig mo yung sinabi ni Senator Drilon, wala sa listahan nyo yung face shield, wala rin sa listahan nyo yung mga ventilators at saka extraction machines. Is that correct? Na binigay doon sa bidding.
Mr. Chairman, I'm told that the mechanical ventilators for 2021, yan po ay binili ng PSDBM at ito po nagkaroon ng Memorandum of Agreement. Can I ask Yusek Carol Taino to be recognized, Mr. Chairman? Yusek Carol Taino, please. For a more...
No. I will ask the questions later on. You can do that because, you know, Secretary Duque, I respect you, no? But please, you don't pass it on. When I was secretary, I don't pass it on to my undersecretaries or to my bureau directors. You have to man up and answer the question yourself because that shows weakness. Kaya ka napagdududahan dahil hindi ka sumasagot forthrightly. And I don't think that is your intention. Pero sagutin nyo kagad na wala talaga yung ating yung sa listahan ninyo at biglang lumabas na lang kaya nakikita ng mga senador. We don't nitpick here. I just raises questions. Okay. Let me now just remind you before I pass it on to Senator Poe na do you have an answer already na mababayaran nyo ba yung mga health workers natin na hindi nabayaran? Sir?
Babayaran ba natin?
Yes, sir. Can you please repeat the question? I'm sorry because I was looking at some data.
At the last hearing, you said that you would be able to get savings so that you can cover both COVID wards and non-COVID wards and all emergency workers. You remember that?
For SRA, yes, this is for SRA, and we have we are waiting the SARO coming from the DBM in the amount of 311,793,000 thereabouts. This will be for 20,156 healthcare workers, Your Honor.
Narinig mo yung sinabi, yung inventory kailangan ng mga health workers natin. Could you submit that inventory?
Yes, Your Honor.
During
Yes,
the
Your
lifetime of today's hearing? Before
Yes,
2:30?
yes, Your Honor.
Okay, so malasabi natin doon kung sino mababayaran at hindi nabayaran.
Yes, Your Honor.
Oh, you have it now?
We will send it to you, Your Honor.
All right, well, the moment you have it, I'd like to get it right away and distribute it to the senators para makita natin yung concern ni Senate President, concern namin lahat kung mababayaran yan because ayaw natin mabara. Because yung mga nurses, di ba, totoo na nag-warn na sa inyo na pag September 1, hindi pa nyo nabayaran, eh, lalabas sila sa trabaho. Tama ba yan?
The President is very clear with this directive. We were given 10 days within which to disburse and pay the 311 million amount to the 20,156 healthcare workers. And today, maybe Yusek Tina Kanda can confirm the SARO is being prepared. Hopefully, it gets released today. Thank you.
Okay, so I will await that. The other one is do you already have that office where you can call on? Because I have all the nurses here. We can ask them. Bukas na ba yung opisina nyo sa lahat ng mga kanilang mga hinaing, yung mga nurses at healthcare workers?
Your Honor, yes, meron na po tayo rito yung ang number 02865.
That's a hotline.
Yes.
Hotline.
Yes, sir. 7800. And then meron po kami ritong CART Secretariat at DOH.gov.ph. Pwede po nilang i-access ito. At saka CART complaints at DOH.gov.ph. So,
Well, that's a hotline.
po namin to. Yes, yes, sir.
Okay.
Yes, Mr. Chairman.
Chat namin.
That doesn't
It's a
answer
chat
my
box
question.
namin. We'll put it in the chat box, Mr. Chairman.
That gives them a hotline, but I think that you should really have an office as we agreed upon where they can all come in and ask the questions, all right? That have to be answered. Finally, there is a question also of the DBM and Secretary Majaltes
Mr. Chair.
Malagay na yung ma-regularize yung mga rating ng mga nurses. Is that
Mr. Chair, Mr. Chair.
Yes. Identify yourself, please.
Robert Mendoza from the Alliance of Health Workers.
Go ahead.
Yeah, tungkol po doon sa sinabi nating babayaran ng mga health workers ng mga benepisyo po. Gusto na natin linawin sa Department of Health kung talaga bang kasi parang focus lang nila babayaran sa SRA. Tapos doon sa discussion sa media forum, sinasabi lang nila na yung mga nasa COVID area lang ang bibigyan. Pero napag-usapan natin nung hearing na dapat lahat na kasama dapat ang mga janitors o mga health workers o iba pang mga workers na within the hospital ay mabigyan. Kaya pwede pong klaruhin natin kung talagang lahat ba ng health workers ay makakatanggap ng SRA benefits kung sa meals, accommodation, transportation.
Let me just finish. I'm not cutting you off, no?
Opo.
Secretary Duque, that was the agreement. And I premise my questions on the fact that non-COVID wards will be included. Hospital is considered a hazardous area. were the chairman of the Commission on Audit. So did you consider that situation?
Yes, Mr. Chairman. In fact, I have expressed my support for that, and I have written the good chairman of the COA about the liberal interpretation of the provision of law in the grant of SRA. So I will await the good chairman's response, because the position of the DOH Executive Committee is it will be best that there will be a law created to allow for grant of SRA to not just those who are directly in care of the patients or in direct contact, but everyone in the facility, owing to the high transmissibility of the Delta variant. Everybody is at risk. And the record will show that I have strongly supported your position, and also the COA chairman had agreed that he will review, and that is why I wrote him a letter. Now, I've also asked the technical advisory group of experts to prepare some inputs that may be considered by Congress and the Senate in crafting a law that will have the technical underpinnings coming from our experts on the matter of the Delta variant and its extreme transmissibility. Thank you, Your Honor.
Secretary
Mr.
Duque,
Chair, pwede po bang magbigay ng rejoinder kay Mr. Robert Mendoza? Maristela po from Filipino Nurses United.
One moment lang, sandali lang, ma'am. Secretary Duque, do not pass it on to us. We said that we can do a law, but you said you're going to look for savings so that you can cover both. And in fact, the opinion rendered by the chairman of COA is towards a more liberalized interpretation. Are you now saying that you are now asking us to draft a bill so that you can do it?
That would be ideal, Mr. Chairman.
But we're not under ideal circumstances right now. We are, our nurses, our health workers are there, and the opinion can be liberally construed. And I'm ready to file that bill, but you said that you're going to do that. So if you're not going to do that, then we still have a problem, don't we? May problema pa tayo.
Meron pa talaga, dahil yung legal basis nga, it cannot be, the liberal interpretation cannot substitute for a legal basis in the grant of, gusto ko po talaga gusto ko na ibigay lahat ng pwedeng ibigay kung may pondo. Ang problema lang po talaga ay baka naman sigurado ako makukuha kami.
Tapusin ko yung statement natin. Tapusin ko na lang. I'm willing to file that bill right away as an emergency measure.
Thank you, sir.
But yung sinasabi mo, I will hold you to that because kami mga lawyer, nagsalita na yung COA, nagsalita ka na ito involves life, danger to life ng mga nagtatrabaho sa mga ospital. Na magtatrabaho sila doon, kahit wala sila sa COVID ward, o mga ambulance driver sila, pag nagkarga ng pasyente yan, lalo na kung walang PPE yan, they're exposed. And every day, that is happening. Every day. So, kailangan talaga, gampanan nyo yung tungkulin nyo. Ang sinasabi ko sa iyo, hindi naman ako ikaw, pero kung ako ikaw, I would take the risk. Hindi ko naman nanakawin yan. Meron na naka-flag sa COA, naka-flag na sa inyo. I would take the risk, and I can promise you, when you take that risk, we will try to pass the bill right away in the Senate if I can get the support of all my colleagues. Kaya medyo talagang masalimuot yan. Pero sa tingin ko, based on what has been discussed here and the statements of COA, I'm holding on to the liberal interpretation which Senate President Drilon, Senator Drilon has also stated, and practically all the senators have agreed to. So on that note, I advise you, take the risk because I'm going to draft. You are also interpreting what in relation to and in connection with. Sa akin, there's no doubt there. Basta ang tao nasa ospital na nagtatrabaho para sa kalusugan ng tao, lalo na itong sinabi ng COA na nasa ere yung variant, pwede ka nang mag-risk na huwag masaktan yung mga tao natin. Yun lang ang sasabihin ko sa iyo ngayon. And on that note, I will relinquish. And,
Mr. Chairman,
Maristela,
unrelated
mabilis lang
on this
tanong.
point,
Sandali lang,
Mr. Chairman.
Senator Angara. Senator Ms. Abenojar, quickly please.
Linawin ng Department of Health yung kanilang memo na lumabas noong August 21 na nakalagay po dito na may we request the submission of the validated list from the Centers for Health Development on or before August 26. Bukas po yan. Ang akin pong katanungan ay ano po ang ibig sabihin ng mga sinabi ninyo sa memo na ito? Ibig sabihin po ba niyan pag hindi niyo natanggap ang listahan ng mga health workers by tomorrow, ay hindi na ninyo maibibigay pa yung benepisyo sa mga hindi nagsusumite. Kasi po ang amin pong mungkahi ay maging proactive ang kagawaran ng kalusugan na instead of just waiting for the list, through your regional DOH offices, kayo po ay direkta ng makipag-ugnayan sa mga pribado at pampublikong ospital at alamin talaga kung sino-sinong mga health workers ang dapat na makatanggap. Kasi po nangangamba po kami doon sa 20,000 lamang na bilang, given na sinasabi po natin ngayon in principle na lahat ay dapat tumanggap at sabi niyo po may 1.8 million na health workers ang ating bansa. Pero 20,000 lamang po yung bibigyan natin ng karagdagan na nakaraan binigyan niyo lamang po ay 360,000 mahigit. Ang target po ninyo ay 500,000 which is kalahati lang ng 1.8 million. So yun po, Your Honor, sana po klaruhin yung ibig sabihin ng memorandum nila na inilabas at sana madaliin din po ng kagawaran yung paggawa ng guidelines na lahat ay makakatanggap. Salamat po.
Thank you. The chair reminds all the resource persons that to ask the questions through the chair. You cannot direct it to the witness. Secretary Duque, please, a quick response.
Yes, Mr. Chairman, there has to be a submission of additional list for SRA recipients, and this is until Thursday, August 26, for the consideration of the DBM. So I confirm that. But we will have to ask the DBM because I'm sure we will be submitting additional lists precisely to address the concerns of our healthcare workers. Thank you, Mr. Chairman.
Thank you. Mr. Benojar, obviously, hindi sila, kailangan talaga masabit lahat ng, tulungan na lang ninyo kung pwede para mabilisan yung listahan, okay? But we will be beside you to make sure that mangyayari yung sinasabi natin dito na mako-cover yung dapat makover. Hindi lahat ikakarga, pero yung talagang exposed at talagang kailangan tulungan, ay dapat bigyan ng tulong. Okay?
Mr. Chair.
Mr. Chair. Excuse me. I have a list here with the permission of Senator Angara and Senator Hontiveros. Senator Grace po is allowed to make his preliminary statement because she doesn't want to ask any more questions. Go ahead. Get your 2 minutes, Senator Poe.
Thank you, Mr. Chair. Yes, 2 minutes. Based on our discussion earlier, the chair reminded the secretary about his responsibility and that he should be able to answer directly the questions propounded to the department. Let me remind those that are here, especially those that have a position in government, that PD number 1445 or the Government Auditing Code of the Philippines says that it says that the policy of the state that all resources of the government shall be managed in accordance with law and regulations and safeguard against loss or wastage. The responsibility to take care that such policy is faithfully adhered to rests directly with the chief or head of the government agency concerned. So hindi po pwede na parang i-delegate palagi sa mga kasamahan sa trabaho, kundi mismo ang namumuno ng ahensya ang may responsibilidad. Again, let me remind everyone that towards the tail end of last year, the Ombudsman has ordered the suspension of 8 PhilHealth executives. I agree with the Ombudsman. Somebody must indeed be held accountable. Habang walang nasasampulan, paulit-ulit po ito at walang matututo. Yun lamang po. Maraming salamat, Mr. Chair.
Both remarks were very correct. Before I call the next one, I would just remind the DBM. Paki-remind lang at i-order po ninyo sa PSDBM kay Mr. Uwayan, UAYAN, at Mr. Panty na mag-submit ng lahat ng mga papeles na hinihingi namin at record sa lahat ng PPE purchases and other purchases. So ordered to the DBM.
Yes, Your Honor. Noted.
Thank you.
Mr. Chair, just a short point, Mr. Chair, if I may be permitted.
I was going to you, Senator Angara. Go ahead, please.
Thank you, Mr. Chair. Before Senator Poe gave her opening statement, you were asking about the legal basis, and Secretary Duque told us, in their opinion, there is no legal basis. And I join your remarks in saying, I think there is a legal basis, but we cannot force our interpretation upon the executive branch. And that is sad, because you would think they would take an interpretation that would favor their stakeholders or the health workers. Pero ganun pa man, meron po tayong batas, yung Magna Carta for Public Health Workers. And that has not lapsed. That is still in force, Mr. Chairman. And there is a provision there for hazard allowance. So I would like to direct the question to our resource persons, particularly Secretary Duque, Yusek Tina Kanda, and maybe the COA. Can we not give them some sort of hazard allowance to our health workers, to our nurses, under the legal basis of the Magna Carta for Public Health Workers? And of course, as Chairman Gordon has said, we will fast track the bill that he intends to file, and I want to co-sponsor that or co-author that with him, because it's of utmost importance. I thank him for his dynamism and urgency in wanting to file that bill, Your Honor.
Pakisagot lang po.
Mr. Chairman, for public health workers, wala pong problema. We will do that because that is the mandate under the Magna Carta law. But to extend this provision to the private healthcare workers, I believe will give us some problems unless...
Wala tayong sinasabing ganun, Mr. Chairman. Ang tinatanong natin, if he views it as applicable to the nurses who have been treating COVID patients as a substitute for the SRA. Since sabi nila, yung SRA nag-expire daw with Bayanihan 2, which we don't agree with. May liberal approach ho tayo, and we have spoken to some legal persons in the government and they agree with us, Pero malungkot nga na kung sino nga ang naatasan na magbantay o mag-alaga dito sa ating mga health workers, sila pa yung kumbaga hindi pabor dun sa pagbigay. And I don't fault them. Perhaps they're just being careful and being safe. They don't want to be subjected to legal action, Your Honor, and let's be fair to them on that score. But dito sa Magna Carta for Public Health Workers, to be fair to the next persons to be asked, can we just get details on what the entitlement of our health workers is under that law specifically, since the Secretary has already said that they are entitled to it? Thank you, Mr. Chair.
Mr. Chairman, yes, we will promptly submit the list of entitlements under the Magna Carta law within the day, Mr. Chairman. Thank you.
Thank you, Your Honor, Mr. Chair. Thank
you. Senator Angara, let me flash the particular provision on hazard allowance for public health workers. Dito ang coverage nung Magna Carta for nurses. Di ba, Secretary Duque? So, lumalabas dyan na meron talagang entitlement compensated hazard allowance equivalent to at least 25% of the monthly basic salary of health workers receiving salary grade 19 and below, and 5% for health workers with salary grade 20 and above. But I will still expect a letter from Secretary Duque to address with particularity the points of Senator Angara. The chair
Thank you very much, Mr. Chair.
For your attendance. Yes, Risa, Senator Antiveros?
Yes, Mr. Chair. Another idea to pitch to the Health Secretary in support of yung advocacy ng Filipino Nurses United at saka Alliance of Health Workers. If I may, Mr. Chair, kasi naghahanap tayo ng solusyon dito sa legislated benefits ng ating healthcare workers. May I, Mr. Chair?
Yes, go ahead. But, we have to address also, I think the point has been made that the Secretary of Health should at least be
This is a
at least
different
take care
idea,
because
Mr.
marami nang sumama sa kanya na in fairness to him, sabi niya gusto niya ibigay.
Yes, this is a different
Nag-iingat lang
idea,
siya.
Mr.
Pero sige na, go ahead.
Thank you, Mr. Chair. Proclamation 1021, which remains valid until September 12, 2021, declaring a state of calamity due to COVID, allows government to use the Quick Response Fund, yung pong QRF, to combat the virus since this is still in effect. Is it possible for DOH to augment the QRF through savings to pay for those healthcare workers' benefits, Mr. Chair, Secretary?
Mr. Chairman, can we have Director Rowena Laura to give a rejoinder in this regard? Because this is QRF, I am not quite sure about the coverage of the QRF. But in principle, I do support whatever, if the QRF can be expanded to include the benefits of the healthcare workers, so well and good. So thank you. Thank you.
Thank you, Mr. Chair. I'll be content with that for now and pursue it during my 10 minutes, noting only na yung QRF na gamit din po to hire emergency healthcare workers. So I'll pursue this further later. Salamat, Mr. Chair.
All right, good. In order of arrival, Senator Subiri, are you going to do your 10 minutes now?
Yes, Mr. Chair, if I may. Thank you.
Please go ahead.
Thank you very much, Mr. Chair. Mr. Chair, the issue that I take up with you today was the issue of vaccination rollout. And I'll be very quick, Mr. Chairman. I had a meeting, as I mentioned earlier, I had a meeting with Ambassador Kumaran the other day. The reason why I raised this, Mr. Chairman, is a number of our colleagues, LGUs and friends have been asking, sana all, di ba? Lahat ng vaccination na binigay sa buong Pilipinas, sa NCR at sa mga iilan ng area, sana all daw. So my point being is, we should roll out the vaccines faster as much as we can to more of our kababayans all over the country, because they're now claiming what they call vaccine inequality, as said by Governor, this was the term given by Governor Remulla, John Vic Remulla in Cavite, noting that Cavite has a larger population than NCR, or Region 4 has a larger population than NCR, but NCR has already almost achieved 50% vaccination. So hindi naman natin minamalait yung NCR dahil ito talagang apex ng variants ng contamination. However, we'd like to ask the IATF, what is their plans for the rollout throughout the country, Mr. Chairman? Because to be very honest, we'd like to know, kaming mga probinsyano, katulad ko, probinsyano po ako, katulad mo, Senator Gordon, who's also from Zambales, we'd like to know what the allocations would be for Region 10, for Region 3, and for other regions on the Visayas and Mindanao and Northern Luzon. So I invited today, Mr. Chairman, Secretary Galvez, and then after Secretary Galvez's presentation, an explanation why he has not yet approved the tripartite agreements to allow more vaccines to enter the country. Maybe we can ask some stakeholders that we invited as well to weigh in on the topic. So, Mr. Chairman, we'd like to ask Secretary Galvez to be recognized, if I may. Secretary Galvez, are you online?
Yes, sir. I'm online, sir.
Secretary Charlie, go ahead and answer the question of Senator Subiri.
Sir, can I be given a few minutes for the presentation? Only 3 slides.
Okay,
So that,
go ahead.
Yes,
Make it quick.
I will share, sir. Sir, for the information of everybody, the main factor of the allocation is through the strategy of focus and expand. Meaning, our presentation is more on areas, alert areas number 3 and 4. So with this is the allocation that we will be coming this coming September and Q4. As you can see in the graph, the first line is the region, and the second is the projected 2021 populations targeted that we have. And then on the third paragraph, we have the number of vaccinated and the number of unvaccinated. So therefore, our next distribution will be equitable based on the number of unvaccinated for the first or second dose. And with that, the allocation will be as follows. As you can see, for September, we are allocating for 25 million. This is the delivery that we are expecting. As you can see, we will only give 951,000 to NCR, and majority of which I think Region 4A will have 3.8 million. Region 3 will have 3 million, and then the other Region 10. Region 10, I believe we have 1.3 million, Mr. Senator. And also the other are also in the millions. So with this, we also expecting to have 114,530,000 for the fourth quarter. We are expecting that our main volumes, particularly Pfizer, Sinovac, and also Gamaleya and the COVAX will have the bulk, including Moderna, will have the bulk of more or less 100 plus doses by the fourth quarter. So as you can see, the majority of the volumes in millions will be equitably distributed to the different areas. So I believe with this allocation, we are ensuring that all provinces and all the regions will be given their share. On the issues of we are holding the tripartite agreement. We want to issue a clarification to the public that it's not desired to really put on hold the tripartite agreement, but the manufacturer are not interested anymore for multi-party because it's become complicated and the coordination is too messy. So Sinovac and Pfizer and Sputnik intends to prioritize the orders of the national government given the current supply constraint. Moderna and AstraZeneca are no longer accepting vaccine orders for the wave 1 through the NPAs for the time being. Johnson & Johnson and Sinopharm are currently not open to multi-party agreement as provided under RA 11525. And yet we have to and also on the issue of the Bharat Biotech, ang Bharat Biotech Covaxin ay wala pa pong high at stock recommendation na required under the Universal Healthcare Law RA 11223 at RA 11525. Naayon din sa batas na tungkulin ng NTF na tiyakin ang price uniformity ng mga bakuna at mayroong issue sa halaga ng nasabing bakuna at ancillary services. Gayun din naman ang napakataas ng local demand sa India kung saan manggagaling ang Covaxin at maaaring sa Nobyembre pa at nagpapatuloy pag-export ng India. Sa ngayon, sir, tinignan namin sa website ng India. Hanggang ngayon po yung ban. I don't know why the ambassador saying that, but in the contrary of the pronouncement of the President Modi, that they will maximize their local production to their population. 940 pa po ang hindi pa po nababaksinate sa India. And there is a question of tinatawag nating definitive delivery. Hindi po alam siguro ni Ambassador Kumaran na pagka nag-sign po tayo ng agreement, 3 months ang aatayin po natin bago magkaroon po na. So yung 10 million na sinasabi niya, highly questionable. Kasi even yung COVAX, nagsabi lang,
I only have 10 minutes, pasensya na lang. Yeah, so we get your point, Secretary. Although, to be honest, to be fair naman with the Ambassador, he mentions, and I quote, because this is taken from our recorded Zoom meeting. And he says, yes, there's the science, there's the price, and there's the supply. All these issues, and then there are all these issues on the regulation process. And I quote, I think in terms of science, it's very solid. He's talking about the 2 vaccines, which is the Bharat vaccine and Novavax. These are 2 vaccines that come from India. He's saying that the science is very solid and very high efficacy rates, and we are confident that we're going to get the WHO approval, WHO. We have used it extensively in India, and he says, and I quote, in fact, even my spouse has gotten Covaxin when she was in India. In terms of pricing, I mentioned it is very transparent. It is much within the range of vaccines in the same variety, and any difference in landed price in the Philippines, the difference lang is the transportation cost, which is higher from India rather than China for obvious reasons, being that India is farther. So he was saying these are commercial terms that the Philippines has agreed to that sheet with that pricing. So pricing should not be an issue. This is coming from the Indian ambassador. So akin lang, Mr. Chairman, gusto natin meron tayong bouquet, no? We have a bouquet, we have a plethora, we have a number of vaccines that we can choose from. Particularly in this issue of supply, as mentioned by Secretary Galvez, it's really a supply issue. Then we should be able to get from all our neighbors. The point of the ambassador is they do not want, we really hope these vaccines can be prioritized from India so that we will not miss the boat. Because once, for example, Novovac, once the WHO makes their orders for the COVAX initiative together with other countries that will give them the EUA, mawawala na naman tayo po ng sa listahan nila kasi wala nga tayong contract to order or to reserve, Mr. Secretary. But what you're trying to tell us with the previous slide is that whether the tripartite agreements will not be signed or not, we have enough vaccines for the coming quarter. You're saying
Yes, sir.
for the next 3 months.
Yes, sir.
I believe the LGUs want to hear that because, you know, there are LGUs waiting in line and they want to find out kung mabibigyan ba sila ng bakuna or not, if it's in trickles or not, because they're ready to order. So what you're trying to tell us, Secretary, is meron tayong bakuna galing sa gobyerno.
Yes, sir. At saka sa ano po natin, sinasabi po natin na sinasabi po ni Ambassador, yung especially sa pricing, malaki po ang ano po natin kasi nakalagay po sa loan. Ako po magsasign po ako doon. Kaya talaga yung pricing po talaga, nakikita po natin napakalaki po 3 times ano po higher po siya sa mga regular vaccine po natin. One. And then yung ang kanyang freight at saka ano po, $1 po ang ating nakikita po natin sa lahat. Umabot po na $4.5 po ang darating sa freight. I think it is irresponsible for me to sign that contract. So talagang nakita po namin talaga may issue po ang Barot
Yes, Secretary, kasi may mga issue kasi binabato sa akin, Secretary, na baka pabogi lang to ng gobyerno, na gusto ng gobyerno sila lang magbigay ng bakuna, wala nang ibang makapagpasok ng bakuna. Para sa ganun ay pagdating sa halalan, masabi lang ng gobyerno, kami ang nagbakuna sa inyo at wala nang iba. Hindi naman ganun.
Sir, hindi po ganun. Kasi nakita po natin, ang ano po namin interest is really not to not. Kasi mangyayari po ang LG po natin kasi order po din sa Covaxin. Makukuha po talaga sila, Mr. President, at saka ano po. Talagang makukuha sila dahil kasi nakita po natin. Unang-una, hindi po sigurado ang supply. Wala pong indicative yung supply. Sinasabi natin 10 million doses. That is for us is still hearsay. Kasi wala pong indicative sa contract. Then second,
ang sinasabi lang nila sa Secretary kasi on the supply, with due respect, no, ang sinasabi nila there's no order, so there's no supply. And they, according to one company, which is the Novovax, they claim that there's no need for down payment. They just need a commitment that there will be a purchase so that they can reserve the amounts para hindi naman tayo maiwan muli ng bus. But anyway, let's already recognize, siguro, Sec, let's allow I only have 10 minutes, unfortunately. With the permission of the chairman, let us look at other tripartite agreements that have been successful. We've had the one of Vicky Razon, Mr. Razon. We've had the one of Joy Concepcion. Let's look at the private sector participation. Is it okay, Mr. Chairman, if we recognize PA Joy Concepcion, if he's around? Is PA Concepcion around? Committee Secretary? Because I've had the discussion with
Senator Subiri, who's that?
Yes. Moving forward, Mr. Chairman, kung wala siya, moving forward in our discussion, he really wanted to show that private participation is possible. And the tripartite agreement, Secretary, are not only with the LGUs. Meron yan natang pending na private sector participation. For example, Red Cross, Philippine Red Cross under Section 5 of Republic Act 11525 allows the Red Cross to purchase also, to make these purchases so that we can also inoculate from Apari to Tawi-Tawi. We have the chairman of the Red Cross is our dear chairman of this committee. He knows very well that we're fully capable of inoculating people all the way from Cagayan Valley up north to down south to Tawi-Tawi, as we have chapters in all. May we know the status of the tripartite agreements dito sa private sector, Secretary? Hindi ba inyo pipirman like the ones being requested by Mercury Drug, Unilab, and all the others? Para katulad ng Estados Unidos, papasok ka lang ng CVS, bibigyan ka kaagad. Wala nang tanong-tanong. Gusto mo ng bakuna, bibigyan ka kaagad. Baka kaya naman ng ating mga kababayan kung mura lang, katulad ng AstraZeneca at 500 pesos per 2 doses to be able to buy on their own and be able to inoculate themselves. What is our status on that, Secretary?
So nakita po natin, maganda po yung yung example po natin sa sa AstraZeneca and also sa Moderna. Dahil kasi very transparent po yung ating yung ating tinatawag na tripartite agreement. The only problem in Bharat Biotech at saka po sa Novavax, hindi po transparent po yung tinatawag natin yung hindi po transparent yung IP Biotech at saka yung another company is involved. Hindi po alam ng NTF. So they're signing a negotiation with the LGU and they're asking for advance commitment. Na wala po sa wala po sa law yan. Dapat kasama po ang NTF sa negotiation. So wala po problema. Kaya nakita po natin maganda yung yung ICTSI at saka po yung yung tawag nating yung Moderna because we are involved both the tri-party involved in the negotiation. And also with nakita natin si Sir Joey very transparent and also the AstraZeneca is very transparent. In this kind of the negotiation, wala po kaming face-to-face negotiation ng dalawang party po niyan, yung Novavax at saka po yung Biotech. Yung Novavax meron po tayo. Pero yung
Secretary, just to be clear, no, you were in Pune. They invited you. You went to their plant in Pune. So that means nagka face-to-face po kayo, Secretary.
Sir,
you went to India to witness the manufacturing facilities of Novavax to the Serum Institute of India.
Sir, actually, sir, yung natin, yung sa I'm referring to Bharat Biotech. Actually, yung sa Novavax, wala po tayong problema. As I have said to you during the dinner, that if ang issue natin sa Novavax is only the regulatory and also supply. So regulatory meaning.
To be fair, Mr. Chairman, to be fair, maybe we have members here representing the Bharat Biotech, which is the most widely used vaccine now in India, which helped them bring down their cases from 400,000 to 30,000 a day. Maybe recognize them, Mr. Chairman. Who are the individuals of Bharat Biotech here to give their side? Would you like to be recognized? Any one of those?
Good afternoon, Your Honor.
May you state your name?
I'm Deepo Bhatia, sir, representing Ambitech Biopharmaceuticals.
May we recognize him, Chairman, quickly?
What's his name?
Deepo Bhatia, sir.
Just a moment, Senator Subiri. Before they answer, I just have to, para maintindihan ng tao ko yung pinag-uusapan natin. Mabilis lang ito. Secretary Galvez, ang rule, gobyerno lang ang makakabili. General rule, correct?
Yes, sir. Actually, sir, ang general rule, sir, is gobyerno. But during the national vaccination program, we allow the tripartite agreement or multi-party.
That's what I was getting into. Susunod dyan, pwede yung tripartite agreement. So far, ang nangyari lang dyan ay yung AstraZeneca at saka yung Moderna, hindi pa na-deliver yung Moderna, mabagal, correct?
Sir, sa ngayon po, sir, totoo po yan, sir. Bali, it's coming on only a few hundred thousand.
May be allowed to interject, Chairman. No? Under our law, Republic Act 11525, Section 4 and Section 5 allows LGUs and private sector to purchase and to administer vaccines. So under the law, pwede yan. Pero they have to follow yun nga, kung ayaw ng manufacturer, may tripartite agreement talaga dyan, Mr. Chairman. But under the law, they're allowed.
Let me just continue, mix para Senator Subiri.
I just wanted to point that out. We have a law.
Secretary Galvez, narinig natin tripartite agreement, pero ang totoo niyan, yung mga, katulad sinabi niyo, ang mga suppliers, hindi basta hindi basta makikipag-deal, kundi sasamahan ng gobyerno. Dahil yung World Health Organization gusto nila ma-equalize, walang tinatawag na vaccine imperialism. No, na talaga yung malaki lang ang meron, gusto nila ma-equalize. Tama po ba yan?
Yes, Your Honor.
So ini-equalize ng World Health Organization, kaya meron sila ng mga COVAX, di ba?
Yes, Your Honor.
Okay. Malinaw na po yan. Fourth, ito last question ko. Yung pong Pfizer, and I'll address it to both you and Secretary Domingo of FDA, clear na ng US government na hindi na siya under emergency. In other words, to me, that sounds like, and I'll have Director General Domingo of FDA answer me, pagka ginawa mo yun, pwede nang bumili ang tao direkta sa pharmacy. Tama po ba yan?
Yes, Mr. Chair. Sa US po, dahil doon po nakakuha na sila ng marketing authorization, so magiging available na po siya directly pwede po sa public na.
Correct. Yun ang sinasabi ko. Ano ngayon ang impact sa atin yan? Pwede ba tayong bumili doon? Import doon? Dalhin dito?
Hindi po. Ang Pfizer, kailangan din pong kumuha sa atin ng Certificate of Product Registration. So, usually po yung company, kukuha muna sa US FDA and then mag-a-apply na rin po sila sa iba-ibang bansa ng marketing authorization. And we anticipate po na sa atin siguro kukuha na rin sila soon.
So, that's my question now. Kung nakuha na yan, marami na susunod sa Amerika niyan. Luluwag yan dahil pagka nabuksan na ang merkado, pupunta na sa atin yan, magpapaalam sa inyo para may certificate of registration sila at para may imprimatur nyo na pwede nang ibenta ito sa mga pharmacy with doctor's prescription, correct?
Yes, sir. At pinadalhan na rin po namin sila ng mga requirements para nga po makapag-apply na rin sila soon.
Maganda yun because you're being proactive. Hindi nyo hinintay na lumapit sila. Talagang sinusugod na natin sila para mas mabilis tayo sa vaccine, correct?
Apo.
And having said that, back to to General Galvez, ang totoo niyan, marami tayong vaccine. Totoo ba yan? Maraming vaccine o kulang natin vaccinators or kulang natin distribution? Ano ba ang problema talaga doon?
So ngayon sir, ang sir natin sir, nakikita sir natin ang kulang pa rin po yung vaccine natin. Pero ang nakita po natin this coming September and fourth quarter, magkakaroon na po tayo ng bigger volumes. So I believe ang ano po natin, magkakaroon po tayo ng gustong vaccine this coming fourth quarter po.
Wala nagba-vaccinate ngayon mga local governments, correct?
Yes sir, yes sir. They have the capacity po sir.
Tapos nagbibigay kayo sa Red Cross, halimbawa, nagbigay kayo sa amin ng 30,000, ikinakalat natin sa Region 4, 4A.
Yes, yes sir, yes sir.
Hanggang Manila. Alright?
Opo sir.
So, meron tayong mga buses na umiikot ngayon, dinadagdagan natin para makapag-vaccinate. Sapagkat pag hindi nagpa-vaccinate, ito, public service ito, pag hindi nagpa-vaccinate, at ang totoo niyan, gusto kong sabihin nyo, gusto sagutin ito ng Secretary of Health at saka ninyo, kahit na ikaw ay nagpa-vaccinate, pwede kang magkasakit katulad ko. Tinamaan ako, katulad ng isang tao ko na vaccinate na, AstraZeneca pa, magkakaroon ka pa ng COVID. And hopefully, hindi fatal. But there are already signs na ang tawag doon, nag-overboard. Ibang term doon, tumatagos yung vaccine, hindi nako-cover. Tama ba yan, Secretary Domingo?
Breakthrough.
Breakthrough infections.
Sorry, tama. Sorry, I'm not a doctor. Go ahead. Nagbe-breakthrough. So that is a consideration and I'm sure marami nanonood dito. Kailangan magpa-vaccinate kayo para meron kayong at least kalasag para pag tamaan kayo, hindi mas matindi. Pero ang totoo niyan, meron pa rin namamatay kahit na na-vaccinate. Pero mas konti yung kaysa doon sa na-vaccinate. Tama po ba yan? Secretary of Health.
Yes, Mr. Chair. Doon po sa ating monitoring, no, meron naman po tayong nakikita na meron po talagang breakthrough, pero talaga pong nagde-decrease drastically once people are fully vaccinated. Pero syempre po wala naman pong 100%
Yan
na
ang gusto ko
efficacy na
sabihin mo
vaccines.
para malaman ng tao, para hindi natatakot. Kasi kumisan, pinipilit mo ba yung tao na may miloso po pa yung iba na hindi naman masama yun. Kung ayaw mo pa-vaccinate, ikaw na lang yun. Pero pagka hindi ka nagpa-vaccinate, tamaan mo pa yung asawa mo, tamaan mo yung pamilya mo, tamaan mo yung kapitbahay mo, lalaki ang problema natin na wala na tayong pang-ayuda, dadami ang problema. Tama ba yan?
Yes, sir. Yun po. Yun pong talagang mga unvaccinated, mas malaki ang probability na magkasakit, makapanghawa, at magkaroon po ng severe disease at mamatay from COVID.
All right. Okay. Secretary, Senator Subiri, go ahead.
Mr. Chair.
Please.
Thank you, Mr. Chairman. I just have two people that I'd like to just interview really quickly, Mr. Chairman, to give them at least their due process. Yung sa Bharat, Mr. Chairman, may we recognize him, Bharat India, to give a statement on what Secretary Galvez has said, and then maybe Dr. Liachon is raising his hand. And after that, I'm done, Mr. Chairman, really quickly.
You can be the chairman of Blue Ribbon because you're now telling me who to recognize.
Yes, Mr. Chairman, that's why I'm telling you who to recognize. I'm asking to recognize.
I will ask for. I will have a caveat, Senator Subiri, because when you gave me that long list, sabi ko mag-submit sana sila ng kahit na one paragraph kung ano sasabihin nila. So right now, I don't know what they're gonna say. But out of respect to you, okay, the previous person kanina, the Indian guy, are you Indian or?
Yes, sir. Deepo Bhatia, sir.
Yes, go ahead, please. Speak up and tell us your name. Dipu Batya. Di po ako si
Yes, sir.
Batya. Tama yan? O sige, go ahead,
Yes,
go
sir.
ahead.
So good afternoon to the honorable representatives of the Senate and to the rest of the committee members present in this session.
Direct to the point.
Your Honorable, my name is Deepu Bhatia, representing Ambitech Biopharmaceuticals. Sir, may I be given time to introduce very quickly the three companies involved and also the price and the supply
Just go
question,
ahead.
sir?
We're
Okay.
wasting our time.
Okay, sir. So, sir, I would just like to let you know that in relation to the COVID-19 vaccine procurement, Ambitech is the official consolidator of the COVID-19 vaccine named Covaxin and serves as the primary interface between the local government units and the private sectors. We are duly authorized by the EUA holder for the emergency authorized use for Covaxin. Said vaccine is manufactured in India by Bharat Biotech. Very quickly, sir, I'll let you know that they are also globally recognized for manufacturing vaccines for influenza, diphtheria, polio, tetanus, Japanese encephalitis, etc.
We're willing to stipulate na you're establishing your bona fides, all right? Na magaling
Yes,
kayo, okay? Anong message mo?
Sir, for the question with regards to pricing, sir, to clarify, we are not overpriced. In fact, Covaxin is underpriced. And allow me quickly, Honorable Senator, to briefly explain the costing parameters. Bharat's global export price, as publicly announced, is between $15 to $20. And we secured Covaxin at a price of 15 as we were the first to lock it in. Our total all-in pricing for the Philippines is $18, which is only $3 marginal cost to offset our expenses in terms of freight, logistics, insurance costs, and pharmacovigilance.
Mr. Batya, you're selling. Sell it to the IATF, not to us here.
Sir, I was just justifying, sir, the price so that our IATF.
We cannot do that. I don't have the charter to do that. I'm sorry. I would like to hear you in private or in public, but not in Blue Ribbon time because we're going to have sessions at 3 o'clock. So,
Okay, sir. So
you have a good vaccine, is what you're saying. It's properly
correct, sir.
priced. That's what you're saying, correct?
Yes, sir. Yes, sir.
You have 3 brands here, correct?
Sorry, sir.
You have 3 brands here.
Not
No, sir. It's Covaxin, one brand, sir.
Okay, now the question I have is, have you gone through IATF already? Or FDA? Have they allowed you to operate?
Yes, sir. We already received the EUA from FDA. We also presented to the vaccine expert panel, and we are supposed to present to the HTAC September 1st week, sir.
Oh, then we have no problem, right?
Yes, sir.
Okay, thank you.
Thank you. Finally, Mr. Chair, before we finally, Mr. Chair.
Secretary Galvez.
Sir, I believe the problem here is the inclusion of 2 companies in our dealings with the tripartite agreement. We are directly communicating with the manufacturer.
Yeah.
For AstraZeneca, direct, and also to Moderna, direct. The question is why we have 2 intermediaries, the IP Biotech and the Ambitech. That's my question. And it will create a lot of some sort of questions on the pricing because we involve more players. And the question on consolidator, I believe the public should know that it will increase cost when we include 2 more companies rather than direct.
We've been forewarned. Those are very good points, Mr. Bopit. Please go ahead. I agree with that point. A very quick question to Undersecretary Lau. Meron rin kayong consolidator dyan sa mga binibili niyong PPEs, correct? Sisingit ko na ito. Undersecretary Lau.
Yes, Mr.
Former
Chair.
Undersecretary, hindi ba?
Sir. Yes,
May
Mr.
mga
Chair.
nagbibidding agent sila ng China, correct?
Yes, Mr. Chair.
So, kaya tumataas rin yung presyo nyo dahil yung nagbibidding, may mga lumalabas na mas mahal dahil yun talagang direct supplier, hindi na nanalo. Yun ang papalabasin ko later on sa iyo. I have the documents to prove that, all right? Pero I'm just asking, laying the predicate, ang totoo niyan, tama yung sinasabi ni Secretary Galvez, na pagka kayo nag-bid, dapat direkta mismo doon sa supplier. All right? Hindi yung nakikisaw-saw lang yung mga taong yan.
Yes, Mr. Chair.
Okay? Meron kayo nun, di ba?
Yes, Mr. Chair. we cannot identify who these people are because we only blast requests for bid and they just bid, Mr. Chair. So
If I can, you can. Because a lot of people come to senators and say, pakiusap mo nga doon sa DBM, masama kami doon sa listahan ng supplier. And I hear also, you've been going around saying, oh, mag-supply ka, mag-supply ka. Totoo ba yan?
yes, we use DTI, Mr. Chair, to get as many suppliers as possible.
Yeah, and you yourself have been asking, friends, oh, mag-supply ka, mag-supply ka. That's not the proper way of doing it.
No,
You're a
Mr.
lawyer.
Chair.
You agree with me or not?
Mr. Chair.
Is that the proper way of doing it? A procurement?
We blast it. We send it formal communication, Mr. Chair. It's through formal communication.
Well, okay. You say what you want to say. But anyway, Senator Subiri, are you done?
Yes, just a final point na lang, Mr. Chairman, since I have no time. Hopefully later they can recognize Dr. Liachon and the others.
Yes,
But,
I will try to do that.
Mr. Chairman, just a final point with Secretary Galvez, if I may. Secretary Galvez, I think he's on the line. Sec, so what you're trying to say, the reason why I brought up the tripartite agreement, Sec, really, is just really for more vaccinations. You've seen my advocacy. We want to vaccinate as many people as possible. We met with Secretary Dizon the other night, and you're committed to come up with that schedule of vaccination per region in the next 3 to 4 months. So what you're trying to tell us is basically with the government does not need to go into tripartite agreement because we have enough vaccines, and that the local government can utilize their funds for other important priority measures. Of course, the fight against the pandemic and this COVID-19. Is that correct, Secretary?
Yes, Honor, Your Honor, it's correct, sir.
So we can be assured, all the local governments from Zambales to Panay Island to Region 6 and 7, Mindanao, all the way down to Tawi-Tawi and Holo, that we will be given our fair share of vaccines as well, Mr. Chairman?
Yes, Your Honor. Yes, Your Honor, because we are already refocusing it to the regional. In fact, Secretary Vince already called up with different regions. He had a series of meetings yesterday in order to capacitate all the regions, Your Honor.
So we'd like to thank them for that, Mr. Chairman. We will eagerly await that, and hopefully your promises are kept, Chairman and Mr. Secretary. And I see Secretary Vince Dizon online shaking his head as well in the affirmative. So we're looking forward to that. Yes, we're looking forward to these vaccines reaching all the other provinces. For fellow provincianos like myself, I'm very happy to hear that. Thank you, Mr. Chairman.
All right, Vince Dizon, do you concur with the statement of Secretary Galvez that there will be enough supplies?
Yes, Mr. Chairman.
Really speeding up?
Yes, Mr. Chairman. We will do that. As mentioned by Secretary Galvez, the focus and expand strategy is already on the expansion mode, starting already in August, all the way to the end of the year. As shown by Secretary Galvez, the allocation is very, very equitable. Thank you very much to Senator Zubiri and to the chairman and to all the members of the Blue Ribbon Committee.
Thank you. We now recognize Senator Villanueva. I'm sorry,
Thank you.
Joel. I'll try to speed up everything, but ang dami talagang nakasabog na issues dito eh. I'm thinking of calling a hearing tomorrow, continuing the hearing tomorrow. Go ahead, Senator Villanueva.
Thank you.
Senator Gatchalian, is it?
I'm sorry?
Is it Senator Gatchalian or Senator Villanueva?
I'm not applying for Vice President, Mr. Chairman. But
nothing to do with that.
Pippen, Your Honor, I can be your Scottie Pippen to Michael Jordan. We waited patiently, and I'm sure Senator Ivy is very happy that I'm on deck now. Thank you, Mr. Chairman. I'll go straight to the point. In fact, let me start by saying I joined Senator Mig Subiri on his effort and desire to fast-track the vaccination program. Your Honor, Mr. Chairman, let me just spread into the records. I just met for about 8-9 mayors in the province of Bulacan, and the same problem is that yung supply ho ay kulang talaga, at we have been asking help from our friends from IATF, and thank you kay Secretary Vince at nag-start na yung pagtulong. But for example, in one lab in Bulacan, the past 3 days, 50% yung positivity rate. I hope na matignan natin yung mga nag-spike, doon natin dalhin yung bakuna. I will not ask any questions on that, Mr. Chairman. Si Secretary Galvez is from Bulacan. I hope he knows what's happening there. Mr. Chairman, kanina ho, I wanted to interject, but I patiently waited for my turn because you made mention, pursuing your point, Mr. Chairman, on the expired, idle, unused drugs and medicines in the amount of 95 million. We wanted to know, ito ho ba nasa DOH warehouses pa rin? Ano na ho yung nangyari? Who manages the inventories, yung supplies, itong sa mga warehouses, who has the responsibility of ensuring that these supplies are used and or distributed na? I think this is very important. Secretary?
Respond because it needs the figures. I'm not sure about where they are, but all I know is that's right, it's 95 million worth as per the COA. But exactly where they are is something that the procurement supply chain should be able to identify, Mr. Chairman. Yusek Tainyo, please, Mr. Chairman. Thank you.
To save time, Mr. Chairman, Secretary, to save time, pwede ho ba i-submit na lang before the end of the hearing?
Oh, yes, sir. We will do that, Mr. Chairman, right away.
Because I'm sure you prepared for this, knowing the fact that there's this 95 million. And everyone in the country watching right now, sumusubaybay, gusto nilang malaman kung nasan po yan at gusto nilang malaman na may ginagawa ho tayong paraan, with doing everything we can para hindi ho masayang ito. No? So, thank you. We'll wait for that, Secretary. Another thing na hindi po ako nag-interject kanina, yung issue ng additional funds for special risk allowances. Currently po, what requirements are asked of health workers for them to qualify for special risk allowances? Wag muna nating tignan yung sinasabi niyo na i-extend doon sa currently yung situation natin. Ano yung requirements being asked?
Chairman, as of the requirement is really a certification by the head of the hospital, the facility, to be very clear about who will be eligible to receiving the SRA based on the parameters set by law.
Don't you think, Mr. Chairman, Secretary, don't you think it's weird to ask yung personnel as to when they were exposed to COVID patients, when they are actually taking care of COVID patients? I think it's weird, Mr. Chair.
There is the daily time record to prove their presence in the specific areas of where COVID patients are. So yun lang naman po.
Kasi binabanggit ho doon sa certification, kailangan lahat ng dates ilista mo ho. Halos everyday, ganun po yung hinahanan nyo ho eh. Nandun ka mismo sa COVID patients sa section. So, I just find it weird, Mr. Chair. Pangalawa, Mr. Chairman, ngayong i-expand na ho natin ito, what would be the requirements, Mr. Chair?
Well, the requirements will essentially be the same, Mr. Chairman. There has to be proof that the presence of the healthcare worker is supported by the DTR simply because there's a formula for the grant of the 5,000 SRA, which is 5,000 pesos divided by 22 days, multiplied by the actual number of days that they were physically reporting for work during the month. So meron po tayong formula.
Sige po. Secretary, right now, do we have a ballpark figure how much is needed kung isasama natin lahat?
Mr. Chairman, we have to be We are waiting for the actual submission. That will be the basis for the computation of how much will be needed. But just to give you an idea, for Bayan 1, we released about 3.2 billion. And for Bayan 2, I think we released about, for SRA lang ito, no? About 7 billion. But that's to cover only about 350,000 healthcare workers. Thereabouts, Mr. Chairman.
Secretary, last hearing, yung pong binanggit ninyo, 2 billion pa yung natitira. That could cover at least mga 70,000 healthcare workers if we talk about SRA. Ano na po yung status nito? And of course, we laud the efforts of the President na binigyan po kayo ng 10 days if I'm not mistaken. I remember also during the hearing na well, dun sa statement nyo po na meron po kayong statement na magsisimula na po ngayong August 25. Is that correct?
The SARO will be released today. It's already been released, I am told. So we will already download this to the regions and to the hospitals, Your Honor.
Just to put on record, while we laud the efforts, hindi naman sana kinailangan ito if we acted swiftly. Going to another topic, Mr. Chairman, and with regard to mass hiring of health workers, in November 2020, I think the good secretary would remember this representation raised that there were about 14,553 vacant positions in the office of the Secretary of the Department of Health. Yun po yung nakalagay and as provided doon po sa NEP, no? And ang question ko lang po, how many plantilla positions for health workers have been filled up since the beginning of 2021? And how many are still available at present?
Mr. Chairman, if I can just be given a minute to get the data.
Okay po, sige po. Habang hinihintay niyo po, I'll ask another question. But in the same manner, in the same topic that I am very interested, ito hong mass hiring of healthcare workers, parang sirang plaka na po ako niyan. At alam niyo ho, every budget hearing, binibring up natin ito sa lahat ng ahensya ng pamahalaan. Government being the biggest employer, noong August 2020, government has 653,816 job orders, contract of service personnel. So sa issue lagi ng ending endo o endo topic dun sa ating committee sa Committee on Labor, laging ang private sector would say, why are you pressuring the private sector? Mismo ang gobyerno ang biggest violator ng endo. But having said that, Secretary, I also wanted to ask, kasi last hearing, si Ms. Beltran ng DOH answered that there were 10,157 personnel hired under emergency hiring program ng DOH. In fact, ang target nyo nga daw po is 15,000 personnel. Ang gusto kong malaman ngayon is how many workers also were rehired under DOH emergency hiring? At pangalawa, gaano katagal yung contract nila maglalast on the average?
Definitely, Mr. Chairman, they were all rehired, no? So lahat po sila i-rehire yan. At this will be for up till end of the year, December 31, 2021.
So hindi na po ngayon yung 3 months period, because if you remember, Secretary, during Bayanihan reports, this representation would repeatedly ask the DOH why the contracts of temporary nurses hired under emergency hiring was only for 3 months, 3-month period, no? Considering yung pandemic is about
It's has something to do with the budget constraints, Your Honor. But we are in touch with the DBM to continue to identify sources of funds and the need to extend their contracts of service beyond this year. Can you hear me? Wala, sir? Yan po. Wala pa rin? Can you kindly just check because I seem to be okay?
There. We can hear you now, Secretary. Please.
Okay. Thank you. We would like to hire more. Why not? The need is compelling. But we communicate with the DBM to identify the budget to support the additional hiring of healthcare workers. But right now, the number of health personnel for DBM, we requested them for additional funding, 20,839, which will require a budget of 3.66 billion. So ito yung mga vaccinators, COVID-19 testing laboratory personnel, disease surveillance officers, and also the human resource for health augmentation under the emergency hiring.
Well, thank you, Secretary. No, but I really need to get the data as to how many plantilla positions for health workers have been filled up. And it's important because this has been our advocacy. If you look at the COA audit report for calendar year 2020, meron po kayong total 25,067 job orders. 25,067 job orders, contractual, consultants, and human resource for health personnel serving as an additional workforce to the regular plantilla employees. So gusto lang ho natin muli, alam nyo, taon-taon po, I'm sure, parang sirang plaka na po ako every year. Nire-raise ko po itong issue na ito. And I just hope na yung plantilla positions ma-filled up. And kung wala pa ho yung data, we will wait later today. But the point, Mr. Secretary, I'm sure you get my point. I have been saying this for quite a long time.
Absolutely, Mr. Chairman. And we have I have with me right now the number of vacant positions and the offices where these positions are. No? And we have a total of 13,659. And the status of vacancies is also here. About 5,319 are undergoing evaluation, while 4,070 positions are for posting, reposting, and publication, and also for appointment on transit, about 488. And others for conversion, I think this is very important, or retitling or abolition of positions and those on hold. We have about 1,005 of them. Now, insofar as the action plan is concerned, we have 7,939 ongoing na po yung hiring process, and 122 naman yung mga presidential appointee, coterminus with the incumbent, and then 1,780 we are expediting the hiring process before the election ban. So it's very good that you raised this, Mr. Chairman. No? And others on hold, yung conversion, linked to schools for referral, etc. That's about 1,051. So yan po, we will give you the data, Your Honor. Thank you.
Please, Secretary, but again, at the end of the day, we are in emergency situation. Kailangan natin ng healthcare workers. May mga open, may mga available positions. Sana po kumilos ho tayo dito. Mr. Chairman, another topic dito sa mass hiring of contact tracers also, because I think this is a job generation. We have recorded an all-time high nitong 23 of August, 18,332. We currently have 127,703 active cases as of August 24. I wanted to know, Secretary, how many contact tracers should we hire? Gaano kalaki yung gap?
The ratio for contact tracer to population is at 1:800. And if you are going to use the total population of about 109 million, you would need about 113 to 120,000 contact tracers. But my apologies, Mr. Chairman, because it's the DILG, which is the lead agency for contact tracing. I don't really have the data to identify what is the gap. But that is being worked on. In fact, I was informed yesterday during our meeting with the President by Secretary Ed Año that the 1.6 billion budget has already been approved and for release.
Secretary, pasensya no, but I'm really disappointed because I think yung weakest link dito sa ating game plan in addressing COVID, I think personally, and I agree with a lot of our colleagues here, yung testing at saka contact tracing. And I think yung contact tracing would perhaps play the most important role. Kaya nag-i-spike. Would you agree na ito yung weakest ano natin, itong contact tracing? Of course, number one dapat talaga mabakunahan lahat. But in the present situation, yung contact tracing mo, parang dun talaga kulang na kulang.
I agree with you, Mr. Chairman. The contact tracing is a Achilles heel in our pandemic response, and that is why we have been requesting for additional budget to extend the contact tracers that have been hired, but the number of which is with the DILG, but this number complements the contact tracers hired by the local government units as well. So there's a complementation of the contact tracers to ensure that the quarantine and isolation of exposed individuals will be immediately done to cut the chain of transmission and to prevent the clustering of cases in the various communities.
Secretary,
So you're right, I agree with you.
yes, thank you for agreeing with me. But Secretary, can I just ask one simple question? How many persons can one contact tracer can call in case of a reported COVID-19 case?
The metric there that is being used is one contact tracer for every 15. That's the adequate ratio. One contact tracer for every 15 exposed. No, so that's the case to contact ratio. 1:15. But now if my memory serves me right, parang asa 1:7 to 1:10 ang current case to contact ratio. So kulang pa tayo talaga.
So you're talking with that figures, you're already talking 50%, Secretary. Kaya ang hirap eh. So dun pa lang parang kitang-kita na natin na malaking problema sa contact tracing. Last point, Sir Chairman, no. Dito po sa balikan ko itong special risk allowances sa DOH, who are dito sa report ng COA, who are the unqualified recipients who received COVID-19 allowances amounting to 214 million. Kasi nakalagay po dito sa COA report, and perhaps we can also ask the representative of COA ano yung basis ng COA in conducting that these were unqualified recipients. Siguro yung COA, pwedeng unang pasagutin natin before we hear DOH.
Yes. Good afternoon, Mr. Chair. May I request that the supervising auditor, Auditor Doris Ugay, be allowed to respond?
Yes, please. Thank you, Chairman Mike.
Good afternoon, sir, Your Honor, Mr. Chair. The unqualified recipients mentioned or stated in our COA audit report were those which were in relation with what were being discussed is about those personnel not directly catering to COVID patients or PUIs or PUMs, or not directly in contact with COVID patients. So those were the basis used, that provision was the basis used by our auditors in evaluating the qualification or the entitlement of the recipients. Or yes po.
Ma'am, sinagot na po ba ito ng DOH, itong binanggit nyo na ito? And kung sumagot na sila, what was your rejoinder?
Sir, may mga sumagot po. Let me see the comments. Sir, basically, they Derek, our rejoinder there is that though we acknowledge the services of the health workers, of course we are their entitlement is not absolute, so we have to still to determine their entitlement based on the qualification or the conditions set forth in the law, sir. So that was our rejoinder. But since but our audit final audit decision there is still being on hold, depending on what will be there will be subsequent issuances pertaining to the what is being tackled here in the hearing about the liberal interpretation of the
Exactly. Yun po yung next question ko sa iyo. Pinapalaki na natin and we wanted to make sure na talagang yung na may risk na pumapasok araw-araw sa ospital, makatanggap po. So this would be addressed. Mas magiging liberal itong unqualified recipients na ito. Is that correct?
Sir, we as auditors, it is very hard for us to interpret, to have our own interpretation of the law. So that's why we are. It will be easier for us if the law will be clear, and it will have no problem on us because there are so many auditors nationwide, so we cannot expect that everybody will have the same interpretation of the laws.
Ma'am, so with the current law, you still stand by your decision that this 214 million was paid to unqualified recipients. Is that correct?
Yes, sir. Based on the provisions of the law, sir.
Okay. Secretary, baka gusto nyo sumagot dito sa usapan nito.
Yes, Mr. Chairman, Senator Joel, Your Honor. Dito pala makikita na natin kung bakit talagang mahirap na kung walang malinaw na batas, and this will be left to the subjective interpretation, Eh dito pa nga lang nakita na natin, payment during periods not covered by ECQ. Okay. Payment to unqualified recipients. Payment to health personnel sans complete documentary support. So ang COA talaga, this is part of their mandate to ensure that the basis is very clear, and the less the less interpretation or the less room for interpretation, the better. Kasi ito nakita na natin dito, ang linaw-linaw kung bakit nila dinisallow or bakit nila ito isinama among the findings. And I'm not sure if this could be a future subject of disallowance.
That's why, Secretary,
Yes,
that's
thank
why I asked you kanina, ano itong unqualified recipients na ito? Kayo, yung pinaninindigan nyo na sila ay mga exposed at may risk from getting COVID.
Yes, Your Honor. Most of them, in fact, that is the situation.
Secretary, I don't have enough time, just one more point. With this, I've been going around also. Wala pa ho akong na-meet doon sa amin sa Bulacan na mga nurses, healthcare workers na directly taking care of COVID patients. Wala pa ho akong na-meet na nakapagsabi na meron na silang natanggap na SRA the entire year, Secretary. I just want you to know that sana ma-take note niyo po yun. Lastly, Mr. Secretary, yung pong DOH last hearing furnished us a copy of the utilization noong 13.4 billion allotment under Bayanihan 2. Binigyan po kami ng breakdown ito na sa amin. Based on the data submitted, funds were adjusted. Funds were adjusted for augmentation for operating of DOH supervised hospitals to include accommodation, transportation, and meals from the allotments for SRA and hazard pay in the amount of yan po 3.19 billion and 1.02 billion respectively. Reports were made po, however, that the funds for meals, transportation, and accommodation were downloaded to hospitals in December 2020. But were asked by DOH to return the funds. To return the funds almost immediately, within the same month, according to Alliance of Health Workers. Please correct me if I'm wrong. So ang question ko, how much of the then unutilized funds were returned by the recipient hospitals to DOH, and where were they reallocated, Your Honor, Secretary?
I think they were repurposed.
Senator Villanueva, this is you have to wrap up now, okay?
Yes, sir. Yes, sir.
Mr. Chairman, my apologies. I don't have the figures, the exact, but I can just, with your permission, Mr. Chairman, submit a report on this today, Mr. Chairman.
Siguro ang sagutin na lang, Secretary, what were the working estimates? But we will wait for that report. What were the working estimates of DOH at the time, and why the funds had to be repurposed? Repurposed, yeah. Bakit?
With the permission of the chair, again, my apologies, because it's a bit specific. Can I ask Director Laura to be recognized? Director Laura, please.
Please make it quick.
Yes, good afternoon, Your Honor. Regarding po sa repurposing po ng funds ng mga natira noong December, we believe at the time that we issued the memo requesting for our operating units to for any funds that they may no longer be utilized, na maibalik po sana sa Department of Health. But hindi po kami naghingi ng any amount. Ang sinabi lang po dun sa memo is kung hindi na kailangan that we believe na nakapagbayad na sila, nakapag-satisfy na po ng mga benefits especially benefits ng health workers, na maibalik sana sa Department of Health. Why? Kasi po at that time, mayroon pa pong mga iba po talagang clamor na dagdagan yung sa meals, dagdagan yung sa SRA and sa hazard. Para rin po ma-download din po namin agad-agad yung ibang pangangailangan. At the same time,
do you have a ballpark figure how much it is?
Around 1 billion, sir. It's roughly around 1 billion.
Yes, I know my time is up, so let me just say, Mr. Chair, and spread into the record that it boggles our minds how the funds allotted for SRA and hazard pay benefits adjusted and reallocated to another set of benefits for meals, transportation, and allowances. But in the end, Mr. Chairman, our healthcare workers did not get either. So DOH should trace these funds and see which regional offices and or hospitals still hold these funds and make them accountable. So yun lang ho yung gusto nating bigyan din. And again, nandito tayo para tulungan ang lahat na magkaroon ng clarity and transparency. And at the end of the day, magkaroon ng pananagutan, accountability. Tayong lahat bilang mga miyembro ng kawani ng pamahalaan. Muli, maraming salamat, Mr. Chairman. Thank you sa ating mga resource persons.
Thank you, Senator Villanueva. The points were well made, and just a follow-up, pabilis lang. Secretary Duque, kaya kayo nahihirapan sa tracing, hindi ba unlike Singapore, unlike Hong Kong, unlike other countries, meron na silang single monitoring ng tracing. Di ba? Eh dito lahat ng local governments may kanya-kanyang tracing scheme. Tama ba yan?
Tama po yan. Meron pong kanya-kanya, but the DICT is working with them now to as a platform for interoperability of the contact tracing applications.
And because of that, the cost of inefficient contact tracing is probably staggering in the form of one life too many, correct?
Yes, Your Honor, you are correct.
Kaya nga dapat an effort must be made by the government to talagang magkaroon lang ng single tracing scheme. Kaya ba, my daughter is in Hong Kong, they work there. Pag pumasok ka sa isang malalaman kung ikaw nagkaroon ng COVID o may mga COVID doon, masasabi ka agad at tatawagan ka agad. Kung ikaw ay pumasok at tatawagan ka agad ng health system. That is the kind of health system we want to have. Di ba? Para malalaman
Yes,
natin
sir.
lahat.
Yes, sir. Meron tayong Stay Safe. This has already been adopted by the IATF and has been recognized as the national government contact tracing application. But work goes on in integrating the other systems. I understand here in NCR has been where the efforts for integration have been started. But let me just check on that,
Sorry,
Mr.
I can't
Chairman.
agree with you because to my mind, that is, as you say, the weakest point, the weakest link. So, importante yan, I prioritize ng the guardian of health in our country, which is your department, under your leadership, na dapat malinaw na pagka isa lang ang system natin, malalaman natin kagad kung sino ang tinamaan at sino ang pwedeng nagkakalat, hindi ba? So,
Yes, sir.
importante yan. Importante yan. So, I would advise you na dapat yan ang bilisan natin talaga. Kapag
Yes, sir.
kung meron na gamit, sorry, isa lang ang gagamitin natin para malalaman natin ang tunay, ang punot dulo. Because ang sasabi ngayon, understated yung ating may tama. Ano isang araw nagdi-debate kami diyan yun lang sa testing Sabi ko understated at sabi na iba mag-concentrate na lang tayo sa vaccine. Hindi pwede sapagkat malalaman ba natin na nagkaroon ng 18,000 na tao na may tama ng COVID kung hindi tayo nagte-test? Paano niyo malalaman may tama kung di mo tinetest? Tama po ba yan?
Yes, Your Honor.
Alam kong isuya ka na, nakikita ko sa mukha mo, suya ka na hindi maintindihan.
I'm not, sir. I'm not.
Medyo pipinturahan ko ng konti yung ngiti mo, parang ngumiti ka. That's the problem Kailangan logical tayo, kailangan malinaw tayo. Katulad nung, libre talaga yan testing. Kaya lang nilimit lang natin para hindi magkapatong-patong. Katulad ng vaccine, libre yan. Para hindi magkapatong-patong, sinabi natin, mga doktor muna, yung mga frontliner muna, senior citizens, para may prioritization. Yun ang kailangan mapaliwanag sa tao. Dahil pagka ganyan, sasabihin lang mahal. Anong mahal? Ang nagbabayad nga PhilHealth Dapat PhilHealth ang magbabayad yan talaga Nasa kanyan Kaya nga, may tungkulin rin ng tao na magbayad rin ng kanilang tatawag na membership sa PhilHealth para lumawak, para talaga maproteksyonan tayo. Tama po ba yun?
Yes, Your Honor.
Pareho yan SSS, GSIS, PhilHealth is based, what you put in is what you get. If you otherwise, para civil minimums lang tayo, hindi kakasya lahat yan, bibigay mo sa lahat, walang matitira sa tao. Finally, talin ko lang yung si Laura again, yung COA, sinabi na nga ng COA Secretary. Again, I reiterate, and sabi ko nga, risk-taking on the part of the Secretary of Health, na sinabi na nga na dynamic ang system, ang proseso. Lumilipad na ngayon yung variant. You can get it in the air. Kaya dapat yung sinasabing directly catering to or in contact with COVID-19 patients, dapat interpret yan sa liberal interpretation. Pero dapat talaga, tumaya ka at ito, pinipilit ko na yung mga staff ko, gumawa na ng batas na gusto mong mangyari. Pero dapat, ma-assure natin ang public na kailangan, ang interpretation yan malinaw na tutulungan sila ng ating gobyerno sapagkat pagka nauna na ng gana yung mga nurses natin o yung mga healthcare workers natin, patay-patay tayo. I will now recognize Senator Marcos, please.
Thank you very much, Mr. Chair. And I'm very pleased to be here. Of course, we're all very, very worried about the nightmare scenario of a mass resignation of our healthcare workers and at the same time, a national shutdown of our hospitals. So because of this, I would like to inquire, wondering why am I, are you hearing an echo po?
I am.
Yes, I'm wondering where it's coming from eh. Yes.
Can we trace kung sino yung nakabukas? May nakabukas eh.
There was another meeting kanina eh. Baka that's the one that's doing it. In any case, I would like to call on COA and the DBM to discuss the issues because ang pinaka-interest natin talagang makahanap ng pera para mabayaran yung SRA at hazard pay ng ating mga medical workers. And there seems to be some kind of discrepancy among the funds, some kind of disagreement also with regard to policy. So, I'm trying to think, does the administrator have me on moderated unmute mode? Baka yun ang echo. Admin, please.
Will the admin please check kung bakit may echo? Baka meron kang katabing computer dyan, Senator Amy.
Yan nga.
Nakabukas. Yan. Try again, please.
Is that any better? Ay nako, may aligaw pa rin.
What are you saying?
Yes, sorry. In any case, let me just proceed, no? And I thank the COA for answering very promptly to Chairman Michael Aguinaldo, as well as the DBM, although kanina nga lang binigay, dahil sabi nga ni Yusek Tina, na kinukumpuni pa niya yung mga figures. Yung DOH na obliga ako na isole kasi hindi magtugma-tugma. Ngunit, eto nga, ang klaro is there is money. As of June 30, may 61 million more or less from Bayanihan 1, may 7 billion more or less from Bayanihan 2. Meron ring mga pera galing sa GAA 2020 and of course, andyan pa rin yung 2021. My question is that COA issued in the letter to myself as well as Senator Angara the opinion that the reversion of these funds to the DBM extended the validity of Bayanihan 2 up to June 30, 2021. Ibig sabihin, after June 30, 2021, nag-lapse na yung mga pondong to, wala nang pambayad ng SRA. Medyo nakakatakot to. Ito rin yung opinion ni Yusek Tina Kanda dyan sa DBM na nag-lapse na to, kaya magre-revert. Wala na tayong perang pagkukunan for the SRA. On the other hand, under the GAA, by extending the availability of the said APRO up to December 31 of this year, may unobligated pa under FY 2020 GAA. So ang tanong ko, I'd like to know ano yung opinion ng DBM. Kailangan ba talaga i-revert yan? Katulad ng sinasabi ng COA sa sulat sa akin. So I'd like to ask Yusek Tina as well as Chairman Aguinaldo if he's still there. Yusek Tina, you look well. I hope it's not true na nag-positive test kayo.
Nag-positive naman po. Pero at symptomatic so far. So I hope it continues. But anyway, ma'am, Your Honor, Mr. Chair, the amount under Bayanihan 2 has actually reverted, but we were able to finance the SRA for the 20,000 healthcare workers whose claims have not been paid under the Bayanihan 2 law, and we released it today, and DOH will be downloading it, I would assume, starting this afternoon.
Oh, so you were able to find some money. Is there any other funding left over that, as you know, needs to be paid out? It's much more than a mere 20,000 healthcare workers.
Actually, ma'am, we got it from the MPBF for healthcare workers coming from the government. And for those coming from the private sector, we cannot classify it as a personal benefit. So we actually tapped it from the unprogrammed fund. No, there is a funding backup coming from excess revenues as certified by the Treasury. May natira pa ho. So nasa amaho po yon sa release. The total amount that was released today was 311 million pesos.
Okay, what is left over para mapangako naman natin sa ating mga health workers so they have something to look forward to?
Ma'am, we need to know from DOH how much claims pa they would submit, because at this point, I think they only have a figure corresponding to potential claims. So, kailangan po yun,
Kasi
meron...
wala silang kompletong listahan ng utang natin eh.
Hindi ngayon po yata, they're actually consolidating the claims coming from hospitals, private and public, private and government. So we're awaiting that list in the event that the 311 million pesos is insufficient.
Yes, in the opinion of DBM Sec Abuel, as well as the letter of Chairman Aguinaldo from COA, yung GAA 2020, available pa yan hanggang December 31, 2021. Magkano pa ba natitira dyan?
Wala po ako ng figures ng buo, pero I can submit, ma'am, to your office, the amount for continuing.
So that's clearly available, ano? Wala tayong problema dyan. And then of course, ongoing pa rin yung GAA 2021.
Yes, ma'am.
Ang maliwanag na pera. Hindi natin pwedeng sabihin na walang pera.
Opo.
So, maaari tayong mangako na bababayaran yung SRA ng ating healthcare workers as well as, is this correct ba, sa DOH at sa ating DBM, yung MAT, ADHP at yung iba pang owing sa kanila?
Yung MAT, based dun sa approval na nakita ko, it's not supposed to be provided any additional release, but it will have to be taken from the budget of DOH. So it has to be charged against the savings of DOH. So wala pong release doon. Ang meron pong nakabinbin pa sa amin at this point will be the payment for yung sa mga tawag nilang vaccinators at saka yung mga HRH, yung Human Resource for Health Sector, meron po kong unpaid doon na, as mentioned kanina ni Secretary Duque, is around 3.6 billion pesos.
That's right. So, may pera talaga. Yun nga ang itatanong ko. So, kung pwede ma-update tayo sa GAA 2020, tapos yung sa vaccinators at yung mga so-called mako-convert sa savings, itatanong ko lang kay Chairman Aguinaldo kasi nariyan na rin siya. Tama po ba ito dito sa page 2 ng inyong sulat sa number 4? You stated that the unobligated sums of GAA 2020 are now extended up to December 31, but Bayanihan 2, all the sums therein that have been unobligated of June 30 of this year need to be reverted to the National Treasury as they have already lapsed.
Good afternoon, Chair. Yes po, that's our understanding. Yung GAA 2020 po was extended for another year. Pero yung sa Bayanihan po, I think nag-lapse po siya noong June 30, 2021. So kung hindi pa po na-obligate, normally nire-revert po talaga yon.
Are we saying that we will also revert all the massive sums that remain with the GFIs sa Land Bank, sa DBP, sa Field Guarantee, katapos yung malalaking halagarin na nananatili pa rin sa ating mga LGU, magre-revert lahat yan?
Well, that's the concept there. Kung hindi pa po na-obligate, ang effect po nun dapat i-revert po sa Treasury. And it would be up to Congress to again appropriate the amounts.
Yes, that's a concern because I think the DBM as well as Senate LDRNO have different opinions on the same, and I urge you to come to a common policy so that this will no longer be another cause for delay and frustration for our healthcare workers. Kasi iba yung kanila eh. Sa kanila eh, ongoing pa rin daw. While the pandemic persists and the president has not withdrawn his executive order.
Opo, Mr. Chair, I think this is something that can be discussed with DBM po to firm up the policy. Ito po yung magiging observation po namin. But then if we can be convinced otherwise, we're very open naman po.
Thank you very much. I know the chair is always open to all sorts of opinions, and certainly given the sad state of affairs, we need to pay our healthcare workers ASAP. Thank you very much to both USEC as well as Chairman Aguinaldo. Nais kong tawagin ang ating PhilHealth.
Chair, can we just let Senator Amy know that there's an echo para lang marinig siya ng maayos yung iba? I think you might have another gadget open nearby.
I wish I had the capability to do that, but we should cancel the contract with whoever is running this this operation. Will the admin please take note that there are echoes?
Ayun, nawala na. Nawala na kay Senator Gordon. Sa akin na lang.
Meron pa. Meron pa konti sa'yo, Amy. Baka sa iyo eh. Tingnan natin. No?
Oo nga. Pinapatay ko na lahat ng gamit dito.
Can everybody please check whether you are open? Pakisara nyo muna yung i-mute nyo muna yung sarili nyo. Thank you.
Okay, tatawagin ko lang sana yung PhilHealth Legal. Yung OIC ni Attorney Del Rosario ko. Please introduce yourself, Mr. Chair.
Good afternoon, Mr. Chair. Attorney Jose Mari F. Tolentino, Office of the Senior Vice President for Legal Sector, Mr. Chair.
Office of the Senior Vice President, saan?
Legal Sector of the PhilHealth, Mr. Chair.
Legal Sector ng PhilHealth. So you were with PhilHealth?
Yes, Mr. Chair.
Haba naman ang title mo, Office of the Senior Vice President for Legal. Ang dami naman. Okay, so you're from PhilHealth. Go ahead.
Yes, Mr. Chair. As early as May, this discussion occurred already regarding the circular of PhilHealth as early as 2016, initiating investigations against false claims and suspensions on a broad scale of hospitals and other health facilities. So I flagged this to PhilHealth as early as June 11 kasi yung number of allegedly false claims lumobo from December to August of this year. Naging 15,000 na yung allegedly false claims. Nagtataka ako, mahigit kumulang lang naman 850 ang ospital. Ang dami-dami namang false claims bigla. Maraming nagre-reklamo, and I know that Cebu hospitals, Perpetual Succor, Chongpa, Adventist, all complained about this because they were immediately suspended for all sorts of payments. Tinanong ko ngayon yung PhilHealth Legal, yung arbitration office, 86 billion ang utang sa iba't ibang ospital. Pero yung fine na pinapataw ng ating PhilHealth Legal ay nasa 640,000 lamang. Magsha-shutdown ang lahat ng ospital dahil sa fine na pagkaliit-liit, samantalang yung utang, bilyon-bilyon. Tama ba yun?
Mr. Chair, if the good senator refers to cases filed before the arbitration department, Madam Chair, unfortunately, it's not under the legal sector, Madam Chair. It's with the Office of the COO. So, ang sa legal sector po, from the fact-finding, investigation, and enforcement department hanggang prosecution level lang po. Pag may finding na po ng prima facie case, tsaka pa lang po magfa-file ng formal complaint before the arbitration department. Yung arbitration, ang adjudication department na po ang pangalan niya ngayon, sila po ang nagre-resolve at nagpapataw ng kaukulang penalties, including fine, Mr. Chair.
Yes, but Attorney Tolentino, tama po ba yung sinasabi na while there's a disagreement between PhilHealth and the various health facilities, sigurado na talagang bilyon-bilyon ang utang natin sa ospital, hindi po ba?
I cannot confirm nor deny that the figures, Madam Chair, maybe the appropriate department who are with us, Madam Chair, because those are money matters, Madam Chair.
Okay. Let's go
Mr. Chair.
back to your quasi-judicial power then. Is it the fact that when you investigate, you also have the power to suspend?
Suspend the accreditation, Madam Chair, or are we talking about the suspension of payment of claims, the more recent?
All payments of all claims.
Yes, Madam Chair. With the
During this whole period of COVID, we're fully aware that pneumonia was first discovered and later on nagne-negative sa napaka-primitive na COVID test at that time. So they were all considered fake claims, when in fact, it was just the lack of knowledge and experience with COVID-19. Hindi po ba ganun yung mga kaso sa tatlong ospital ng Cebu at napakarami pang ospital?
Yes, yes, Mr. Chair, may mga ganyang kaso po. For us in the legal sector, yung mga claims po kasi pinoprocess muna sa mga regions. Minomonitor po yan. Our HCP pass, yung Performance Assessment System, and the MIDAS, ito yung parang IT namin, makikita po doon kung may mga red flag na mga claims. Ngayon, iipunin po siguro yan, and kung sa tingin nila may reason for the legal sector to conduct a fact-finding investigation, doon pa lang po magsisimula ang proseso pangangalap ng mas marami pang impormasyon para makita natin doon sa investigation report kung talaga pong may claims na dapat irekomenda. Irekomenda pa lang naman po ng fact-finding yon kung necessary na isususpend yung particular claims.
Status of the alleged 86 billion claims of all the different hospitals. Anong status nila? Kasi ang dami-dami sa sinasabi na talagang magsususpenso kayo kahit you deny that this was a new circular and that in fact this circular was 2016 pa. Ano ba talagang mangyayari dito sa utang natin sa ospital? Acknowledge naman ng lahat na utang eh. Tapos kinakasuhan pa ninyo. Ano ba talaga ang balak natin?
Madam Chair, as to the payment of claims, I'm sure I'm definite that pinoproseso naman po yung mga good claims. Talagang pag nakitang good yan, binabayaran po agad.
Your office has jacked up the numbers. From 9,000, it's now 15,000. Apakadami na nito. Parang sinasadya na eh, pagkarami-rami naman. Kung sa bagay, dati-dati, ang tawag namin dyan sa mga false claims, livelihood.
Well, Madam Chair, we only act upon the reports. Kunyari may natatag sila na tingin ng ano natin.
Sudden multiplication of all these claims. So what do you ascribe this huge increase?
Ng fraudulent claims, Madam Chair?
Bakit napakarami biglang lahat fraudulent?
I think I would attribute it also to the increase talaga ng number of claims ngayong panahon ng pandemic. I think our IT also can sila po kasi nagagather ng lahat ng ng claims together with our PhilHealth regional offices. Ngayon po kami sa legal sector, we act only upon kunyari may recommendation o imbestigahan po itong particular to kasi parang tumataas yata yung parang nakakapagtaka bakit nagki-claim pa sila ng ganito karami. And then, the investigation begins.
Isa't kalahating taon na tayo nagdudusa sa COVID. Hindi naman nakakagulat yun. Talagang dapat mag-claim.
That is correct. I agree with that, Mr. Chair.
Yun pala yung
Yung
agree
claims
mo
po. Yung claims po.
Perhaps what we can do, this investigation, after all, under the Blue Ribbon Committee of my chairman, Chairman Gordon, is in aid of legislation. Masasabi ba natin na may abuse of the overarching and extremely broad and encompassing quasi-judicial powers ng PhilHealth Legal? Unlike NLRC, halimbawa, LTFRB, ang lawak-lawak eh. Kayo na ang mag-iimbestiga, kayo ang magsususpend ng payment, ultimately, kayo rin ang magdidesisyon na magbayad.
I would say, Madam Chair, Mr. Chair, na in the present organizational structure ng legal sector, as regards filing of cases, I would say it is very efficient and effective. I mean, because we start with fact finding muna.
Well, the opinion of the hospitals, including the medical workers and the private hospitals, is that it's in fact abusive.
Mr. Chair, we make sure that
and effective.
we ensure that due process and all the rights of our stakeholders are respected and observed, Mr. Chair.
Sige, ganito na lang. Maybe you can give me a breakdown of the claims in the past 2 years at saka yung mga ospital, isubmit mo sa ating chairman. Okay?
Mr. Chair, clarify ko po, claims po ba or cases?
Hindi yung claimants na lang na sinasabi ninyong false claimants. Para bigyan na natin ng pagkakataon or ikaya, ibukod na lang yan. Tapos yung mga hindi naman false claimants, bayaran na.
Yes, Mr. Chair, we will coordinate with with our departments na in charge with those claims processing.
That's right. Kasi iba-iba ang listahan eh. Hindi magkaisa eh.
Senator Marcos, please wrap up.
Yes, thank you very much. I would just like
Charge you double because you were echoing eh.
Kaya nga, sorry. I can't seem to figure it out. I'm really sorry.
Sorry about that.
I just had one question or
Go ahead.
request from FDA regarding Bowman Technologies and Nika Trading. Both awarded with several bids, even if they were not registered with the FDA. And finally, I'd like to inquire with my chairman if we could call the other members of the team of USEC Cloud, formerly with DBMPS, Christine Marie Suntay, and Attorney Sami Dagpin, all apparently involved in the mass exodus in June of last year, DBMPS. Thank you, po.
Ordered. The chair directs the Director General to subpoena also these two folks that were identified by the name of Secretary Christine. What is the name, please?
Marie Suntay.
Marie Suntay.
Opo.
And
I think a certain attorney, Sami Dagpin.
Sami
I believe
Delphine.
he's now the chair of the Government Commission on GOCCs. Is that correct? He's still with the government.
He's the head of BCG now. GCG.
GOCC, yeah. GCGOCC, yeah.
Yes. So ordered. Thank you.
Thank you very
Senator
much.
Marcos.
Yes, Your Honor.
That's a very hefty interpretation. I just wanted to ask, and we direct the PhilHealth folks to deliver the request of Senator Marcos. Remember, show us the records of who you owe, all the hospitals and everybody you owe. And by the way, hospitals include physicians. Like in the case of Makati Medical Center, you owe them 1.8 million, 180 million in hospital receipts, no? And also about almost 300 million in the form of doctor's fees. So kindly submit those to us from the biggest to the lowest, all right? And of course, the matter of people who are you express as fraudulent. We want to see kung talagang fraudulent because I investigated PhilHealth, if you will recall, and there were a lot of fraudulent claims that were not being given attention to. All right, Attorney.
Mr.
We will
Chair,
comply,
Yes.
Mr. Chair,
Attorney Tolentino, you're so ordered. Make sure that Secretary, I'm sure Director General Giran is there, but I'll call him later. Go ahead.
thank you, Mr. Chairman.
Yes.
Just a rejoinder to the answers of Attorney Jim Tolentino to the questions
Yes,
of Madam Marcos, no? Yung tanong na bakit napakadami pong na-file na kaso, no? Alam niyo po, mahal na chairman namin, order po yan ni Presidente when before I sat foot at the PhilHealth. Order po niya imbestigahan lahat ng mga kaso. So kaya when I took over, talagang pinaimbestigahan ko yung mga kaso, ano. At saka isa pa, lumabas po sa investigasyon po ng 2 kapulungan na halos mangilan-ngilan na po mga kaso na i-file ng PhilHealth sa mga supposedly airing authentic partners natin. So that's the reason na I give the order na imbestigahan talaga. Kaya ganun kadami, Madam Amy. And then yung isa pa po ay because isa pa diyan talagang napakadami na po ng claimants. Before we came, the average claims per year, Mr. Chairman, was only something like 12 millions claims in a year. Pero at the rate we are going right now, January to July of 2021 po, at the rate we are going, something 14 millions na po ang claims na marireceive namin matatanggap sa PhilHealth. At isa pa, pangatlo po, yung sinasabi po ng ating kagalang-galang po na senadora, na Madam Amy, na in process na 84 billion, hindi po tama yon. Kasi yung sa 84 billions po, ay kasali na po diyan ang pagkwenta ng ating mga healthcare institutions doon sa mga claims na naibalik because of RTH, because of some formal requirements, and those naibalik na mga kaso because for denied claims. Yung denied claims talaga po, jurisdictional po yan. And yung sinasabi po na yung comment po na ating kagalang-galang na senadora, Madam Amy, na ang PhilHealth ang nag-imbestiga, PhilHealth nag-file ng kaso at suspend. Ano po yan? May measure po yan of what we call this due process. Kasi while ang PhilHealth po, mga regions ay nag-imbestiga ng kaso, pero ipapile din yan sa isang ipapile din yan sa prosecution. And then from prosecution po, ipapile din yan sa arbiter. And then from the arbiter po, diretso po yan sa board. So, marami pong dadaanan po. Sa board pa lang po, Mr. Chairman, bago lang akong pumasok sa sa PhilHealth, pero napaka-lively po, kuminsan mainit ang talakayan po doon sa board. So, talaga makikita niyo po, Mr. Chairman, na talagang there is due process on this. Salamat po.
Thank you very much, Mr. Chair. I would just like to thank Attorney Giran. I know him from the NBI to be a competent and upright public servant. Kung sana mabigyan kami ng datos ng PhilHealth upang ipakita at malaman ng ating mga ospital na sumusunod talaga tayo sa proseso. Higit sa lahat na mabayaran na yung mga ospital at kinakailangan natin silang lahat ngayon sa panahon ng ano bang masasabi, pandemonyo. Salamat.
Salamat po, Mr. Chair. Salamat po kay Madam Amy na hindi niya kalimutan si Manong Dante niya. Salamat po.
Thank you, Mr. Giran. I just want a little bit of housekeeping. Executive Director of PSDBM is required to submit all the DBM records, PSDBM records on the bids that won during bid opening, all bids conducted for Bayanihan 1 and 2, we're displaying it on the wall. The bids that were later on disqualified during post-qualification. All the contracts and notices to proceed they issued pursuant to all the public biddings they conducted under Bayanihan 1 and 2. So you know whether some may have been favored and or whatnot, because there have been a lot of complaints being sent to me. And what was the difference in the prices of the original lowest calculated bid and who eventually won the contracts? So ordered. And also the DBM is also hereby ordered to submit to the committee all documents on negotiated contracts and or bids undertaken for the purchase of PPEs, masks, shields, and all good and or services in relation to the COVID-19 pandemic, including the ones that were mentioned by Senator Lacson and by Senator Dillon, ventilators and other equipment, including minutes taken, circulars and resolutions and memoranda relative to these acquisitions. We will report in part because this should. I expect that there will be. I've gotten used to that in the Blue Ribbon. I'm about to come out in my report. We report in part so that it can be readily understood and can be intelligible to the public. In the meantime, the next guest is the next senator is the Honorable Pia Cayetano. Senator Pia?
Thank you, Mr. Chair. Thank you. I'll take off from a question previously asked. I think it was Senator Joel Villanueva about the contact tracing. And our Secretary, Secretary Duque, referred to our Stay Safe app, no? Secretary, baka you want to elaborate a little bit because, you know, my understanding of the Stay Safe app is as simple as this. It's an app that stores, restaurants would use. So if people enter, they have a choice to manually log their data, their name, their contact number, etc. Or they can use the app. And that's all it does. It's a digital log of the people who go in and out. Is that the extent of the contact tracing that we're relying upon? Because that's what you mentioned, and actually I've never heard anything else anyway. So that is the contact tracing that we have in place.
I'd like to ask Mr. Chairman if the DICT is around. They should be the best agency to answer this because they're the ones on top of this Stay Safe as the national government contact tracing app. When they presented that to us in March, they showed about 5 or 6 capabilities of the system. So one of which is they'll be able to say how many people a person who enters, say, a store that he got in contact with. Meron siyang ganun eh. I'm not a technical guy on this, and I would like to ask if there's someone who might be able to answer that. The DICT po kasi sila po ang talagang nangingibabaw dito. My knowledge is very superficial on this, Mr. Chairman.
Chair would like to know if there's any representative from DICT.
Mr. Chairman, Undersecretary Manny Caintic pala, andyan. Andyan na, sir.
Go ahead, Yusek Caintic.
Mr. Chairman.
Thank you, Mr. Chair. A short reply lang. I just want to know kung ano yung, hindi mahina yung boses mo, sir. I just want to know na tama ba yung intindi ko na all it does, it logs the people who go in and out of that establishment. Does it do more?
Chairman, Senator,
go ahead.
Thank you. Yung Stay Safe, so yung Stay Safe po sa present sa amin, required natin sa supposed to not just do establishment log po, but also to facilitate the recording of the contact tracing done by LGUs. Kaya nga po si DILG at ginagamit ito ngayon at minumungkahi sa mga national government agencies at LGU na gamitin. Subalit po, alam din po natin that various LGUs already have had their own respective naging nationally accepted at na-mandate yan ng IATF. Kung kaya also part of the effort is that the of ATF is for other LGU contact tracing to be consolidated through a central warehouse. Kasalukuyan po namin itong ginagawa na po ngayon with the DIL sa pag-maintain itong central contact tracing warehouse so that the other LGU contact tracing efforts will be across LGUs. Sakaling ang isang tao lumipat or bumiyahe from one LGU to another. That is it po. But Madam, Mr. Chair, alam po namin, ang Stay Safe, meron din po dapat kakayahan to do a recording of the contact trace, the trace data of the positive patient po, ma'am.
Okay. Mahina yung yung audio nyo. So I'll just repeat very quickly what you said. But basically you said that itong data na ginagather ng mga establishments dapat na-access to ng mga LGU and that you are further coordinating with the LGUs because they also have their own facilities. Okay, that's my understanding of your statement. Now, I'll bring you back to the question of Senator Joel, and this is directed again to DOH, but the ICT take note na rin.
Yes po, ma'am.
The question was not answered because in truth and in fact, the Stay Safe app is merely a digital log of yung nakasulat sa parang logbook na papel. That's all it does. It's in our imagination that it is interconnected with the national government's tracking system or the local local government's tracking system, because it is not. So all it is a log of who went in and out. Now, who's tracking that? Who's going to alert that establishment if somebody was positive? Who's going to trace back when somebody is positive in the let's say na local government kung saan siya nagpunta? There is really no one or no system that is doing that. It will now be entirely up to the LGU to determine based on their contact tracing that nagpunta siya sa ganitong store. O sige, tatawag kami sa ganitong store, patingin ng log nyo ng ganitong oras. So that system isn't really in place. That's what I'm saying, Mr. Chair, and that is what I feel that DOH should understand. It's not a matter of being techie or not techie, but accepting the reality that this contact tracing app that you're relying on has limitations on what it can do. And so without people intervening and filling in those gaps, it's not going to do anything for you. It's just a log that individual establishments have. So I want to move on to the next point. I just want to make sure that my point was understood and at some point give me an answer, because I don't believe you can give me an answer that can give me the confidence I need to know that it's a system that's worked, because that system is not in place. Secretary Duque, would you like to make a quick response? Kasi yun ang intindi ko. So I hope I clarified it for you.
Yeah. I think it's a very limited, no, almost no impact. But I think the DIC team should really make the effort to explain, because ang alam ko po rito nung inadapt na yan ng national government, naka-connect sa atin COVID Kaya, yung data repository system ng DOH. Kasi parang doon nila malalaman sino yung mga nag-positive, di ba? Tapos sino yung mga exposed. So, but it was since March pa the last time we had had a an update, no? But
digital log, Mr. Secretary. So I don't want to cut you off. You know me naman, I give all the time to DOH to explain, but I only have a few minutes. So I'll move on to my next point.
we'll echo na lang. We'll echo the concerns, Madam, Mr. Chairman, to the DICT during the next IATF.
Okay, thank you. The next point is also for DOH, no? Hospital bed capacity. I had my staff research, and the bulk of news reports that I've read on hospital bed capacity concerns were raised last year, no? That the hospitals were not being compliant, both public and private, with the requirements set by the DOH guidelines to set aside 30% for COVID patients. I have not seen a report on any specific update that directly addresses that issue. And yet, we keep getting reports issued directly by hospitals saying that full capacity na sila. Well, what is that capacity that they set aside? Did they set aside 30% of their bed capacity so that we know? Because if they did at hindi talaga kaya, then DOH must move on and have an alternative plan. Now, if they did not set aside 30%, then what? I still want to know, what will DOH do about it? Papakiusapan ba yan or papano, di ba? And on that note, on furthering this hospital bed capacity, very quickly lang, can we see, because I do know there is such a report that exists, what are the projections of the need for hospital beds, including ICU, in the next 30 to 60 days? This will be very important considering the limited bed capacity exactly that we have. And your actions will be based on whether that first question I asked is being complied, whether that mandate of 30% is being complied with.
Madam Chair, the report that I came across, the public hospitals are compliant. In fact, hindi lang from 20 to 30%. It's from 30 to 50%. Kasi nga, we need to have more beds to accommodate the rising number of cases. The private sector also has done its part, no? They're supposed to go from 20 to 30%. But
Mr. Secretary, I just want to see that report that shows that they've complied, that they're at 30 and 50%. Are you basically reassuring me that all of them are compliant? They are at 30 or 50%, as you mentioned?
Yes, for the public sector, Mr. Chairman. We will send you the report na lang, Mr. Chairman.
Sana, Mr. Secretary, if you can have an undersecretary or director dig it up now while I'm
Yes.
asking other questions.
Yeah, with the permission of the chair, Yusek Bong Vega, I believe, has the data on this. Mr. Chairman, kindly recognize Yusek Vega.
Mr. Chairman, this is Yusek Leopoldo Vega of the Department of Health. Can I be recognized?
On behalf of the chair, I'll recognize you.
Vega is recognized.
Thank you, Ma'am Pia, Senator Pia. On the query in the number of or the allocation of beds for private and public, for the whole Philippines, we have already 45% of government hospitals or institutions providing or allocating COVID beds. And for the private sector, it's 25% already has complied in terms of the allocated bed. What is being asked for the private institutions is that they have to go as far as 30% if there is a surge. And they started off with initially last year of only about 12%, Madam Senator. And they have gradually increased their allocated beds to on an average across the country, 25%, Madam Senator. Mr. Chairman.
Kindly submit to the committee the actual compliance, because I have information that even some public hospitals are not providing for the 30%. It can be easily calculated kasi when they say that X number of beds have been set aside, pero alam mo na yung number of beds ng hospital na yon is X number, and you know that is not 20% and or 30%. So just give it to me. I won't take up the rest of the time. I will do.
I will do, Mr. Chairman, and Senator Pia, we will do it.
Next point, this is for, well, this again, of course, is for DOH and COA. Chairman Mike Aguinaldo, hello, you're there, no? I'd like to be sure lang that you're listening to this because this very much includes COA's understanding of the issues. Chairman Mike?
Yes, nandito po, Mr.
Hello.
Chair.
Okay. So actually, Chairman Mike, before in the last hearing, I already expressed my support for COA to do its mandated duty. You have no issue with me on that. That is your duty. Do not hesitate to do what you have to do. But I also take note that even before the Senate hearing, you mentioned that, you know, given COVID, you know, obviously there would be certain, and I don't even want to say exceptions, you know, we must provide public service and be accountable. We should not, you know, lower our standards. But I know what you meant, no? Na parang you'll have your team try to work harder in understanding what are the situations. No, that's my layman's understanding of what you meant. Na okay. And for me, I'd also like to believe that this is not just because of COVID, because the point I want to raise is, and just to put it bluntly, no, I won't mince words anymore. A lack of understanding on the part of not just COA but even other persons involved in what it takes to deliver healthcare. So, as you know, I chair the budget hearings of the Committee on Finance for Health, and I chaired the Committee on Health for 10 years. Thus, despite not being a doctor, pareho tayong abogado, I'd like to believe that my understanding in this area is probably deeper than the average person. So experts tell us, and these are universal healthcare advocates, no, primary healthcare advocates, tell us that one of the biggest problems we have is that PhilHealth is meant to be an insurance company. It's meant to insure people against health disasters, you know, iwas sakit, okay? So we cannot set up PhilHealth as it is currently sadly set up as a reimbursement mechanism, which is what it is. So I'll give you an example of a program that should have been rolled out sooner than later, and it still hasn't been rolled out. And at the rate PhilHealth is going, I fear that it won't roll out. It's the Consulta package. Upon consultation with COA, PhilHealth has pegged the Consulta package. 40% is for the benefit of the general public who doesn't understand this, no, supposed to be the way this outpatient care will be given. And I've been waiting for 15 years for this package to be rolled out because we all know primary healthcare begins at home, in the community, diba? Pag dumating ka na sa ospital, malala na sakit mo, medyo huli na tayo. We want to take care of them pag hindi pa malala yung sakit. So basically, you're giving the community doctor or the community healthcare system X amount to take care of the whole community. Now, the way the Consulta package is currently set up is that 40% of that is given to the doctor for basically advising the patient, you know, and doctors will tell you that by looking at them, they can already, and asking questions, they can tell them what their immediate step should be without having to order lab exams, etc. Any good doctor knows that. However, 60% of the package is reimbursable only if they do lab exams and the like. And that's something that we need to revisit, because if you put a cap on the lab tests that people can get, number one, it is an initiative for doctors to order that lab test, even though by sight, they can already tell you na, stress ka pala, nanay, tapos magkakaroon ka na pala, baka dysmenorrhea yan. They can say that without having this woman go through a sonogram, whatever. But if you put a cap there, napipilitan sila to have a test. Meanwhile, that cap is so small for other people who would need a test that's equivalent to, let's say, 5,000 or 10,000 pesos. You and I know that MRIs are like 15,000, 30,000. Wala na. They cannot avail because the cap is 500 pesos total or 750, whatever it is. And 60% goes to that. So my point, Mr. Chair, is that can I get your commitment that let's work with DOH on these issues? I have no issues on graft and corruption. Do your job. Pero on moving towards the delivery of healthcare, hindi ito pwede reimbursement based on lab tests and the like. Do you agree?
Yes, yes, Mr. Chair, we wholeheartedly agree. As you know, we were involved in one of the investigations on PhilHealth, and our focus wasn't only on looking for graft and corruption, but looking at ways to improve their processes. Yung consulta system nga po, we noticed that because one of the problems PhilHealth faces is yung upcasing. No, where, you know, konting ubo lang, sasabihin pneumonia, tapos hospital and all that, no? But we found out that there are some cases na you would say hindi naman talaga fraudulent yung intent. Ang nangyari, matanda na umuubo, ang sabi, uminom ka lang ng gamot, wala naman siyang pambili ng gamot. So ang ginagawa ng doktor, medyo sasabihin niya it's something more so that maging libre yung ano. So maganda po sana if a system can be established like yung konsulta po to address that. Now, itong CAPS, it's similar to the case rate system that you find in PhilHealth, and we did a performance audit on that. Yung case rate system naman on its own, hindi naman masama yun. The problem was, I think, dahil sa dami ng case rates, I think you're looking at, if I'm not mistaken, over 20,000 case rates. The whole idea of case rates is you do a periodic review. Titingnan mo ngayon, is it receptive? So meron kasi dyan, yung case rate mas mataas sa actual, i-adjust mo ngayon yan. Meron naman yung case rate, sobrang baba dun sa actual, medyo adjust mo rin pataas naman yung case rate doon. So it's sort of balancing and harmonizing it. The problem I think is dahil sa dami, hindi nagagawa because there are just too many. Medyo naging unwieldy. So we weren't saying that the case rate was evil, nothing to that extent. No? Ang sinasabi lang natin, it became too unwieldy. And so sana magawa ng paraan. But to answer your question, Mr. Chair, 100% we are very willing to work with DOH and PhilHealth on this. We think that health issues are one of the most important issues when it comes to the Filipino people. In fact, ang sinasabi ko dyan, sa government, yung problema is pag may nagkasakit, mangungutang, tapos tuloy-tuloy na yan. Baon na sa utang parate because hindi na niya mababawi yung sakit. So, the universal health care, and if we can answer really all of these healthcare issues for the people, I think that's really the most important thing. So you do have our commitment, Mr. Chair.
Mr. Chair, I'll take this up more in the even pre-budget.
Can you wrap up, please, because your time is.
I'll post my questions and I'll just ask the agencies to give us a response in writing. Chairman Aguinaldo, salamat. I'll talk with you some more, no? I just want to make public concern and then I'll talk to you more before the budget season begins. My other
concern, right, Senator Cayetano, you want the agencies to answer you in writing?
Yes, well, because there's no time. So office, they can also call my office, but to share my concerns with the others, I'm happy if they write to us what their response will be. I'll post my questions now very quickly. On the vaccine passport, Senator Grace and I have been advocating this. We both have filed bills. May we know from DOH on how they intend to proceed, because as more and more people get vaccinated, it would ease the recovery of the economy if people can safely go out and go to places. So I'd like your views on that. And then DOH, and I don't know if DOST is here, but can we find out if we are aggressively pursuing self-sufficiency when it comes to vaccine testing kits? Your Honor, the chair is an advocate here, and as His Honor said, the vaccine to get the vaccines, it takes a while because there's a long waiting list. So we have to test. Self-sufficiency. Are we encouraging investors to come up with this, or to come up with plants where we can make our own here, do JVs with other companies, and yeah, that's it, Mr. Chair. I just want to tie in that need for testing to the other hearing that's going on simultaneously under the committee of Senator Gatchalian, the Committee on Education, wherein we are talking about the return to school. We are one of 14 countries in the whole world that has never sent our kids back to school. And Secretary, may I ask you to assign a high-level person to work with DepEd on this, because it's crazy, no? I mean, obviously the timing right now is not best, but really all over the world they're talking about kids continuing schooling in mask, and here we are, our kids have never gone back to school. So we need DOH to be more proactive in working with DepEd on this. And to say that they have not been, I think is an understatement, because COCOPEA, which is the largest association of private schools, have never even been consulted by DepEd on their suggestions and recommendations on a safe back to school face-to-face program. So I rest my case. I leave it at that. Kindly give us the response in writing, or you can also call my office. Thank you very much, Mr. Chair.
We'll do that, Madam, Mr. Chairman. Thank you.
Points well taken, especially on the matter of education. We're losing very, very badly here, and these last 2 years has been disastrous to our educational system. Not to mention the fact that our educational system has been rendered backward. Matagal na yan. So kailangan iayos natin yan. Let me just call on Senator Ontiveros. It's your turn. Senator Ontiveros, are you there? Senator Lacson? Senator Ontiveros, are you there? Senator Lacson? We're almost needing kasi the session na. Senator Angara?
Mr. Chairman.
Yes, who's that? The Senator Lacson?
Yes.
Good. I know that you're locked up in your room.
Yeah.
You can run,
Anyway,
but you can't hide.
Thank you for recognizing me. I have a few issues to take up today. And the first issue that I'd like to tackle concerns the DBM, because this okay. I have a slide, that states the DOH financial highlights. And I'd like to ask the DBM to explain this, because a look at this slide will show a continuing appropriation in the amount of 15,371,631,000 pesos under specific budget, CONAP, continuing appropriation for 2020. However, when this item was listed, this time in sub-item B, allotments, the amount became 12,179,343,000. Same item, a specific budget, continuing appropriations. So resulting in a discrepancy of more than 3 billion, 3.19 billion in fact. Now, unlike the other items described as CONAP, namely automatic appropriations and special purpose fund, nabawasan po ito ng 3 billion mahigit. So,
Yes,
sir. Yeah. Should not the same amount of 15 billion plus be reflected in sub-item B, allotments, instead of 12 billion? So, ano yung reason for the discrepancy and where did it go? DBM, please.
Mr. Chair, initially, my analysis here is that from... Teka, sir, ha? Pinag-aaralan ko lang po, sir. Sandali lang po.
Kasi pag sinabi natin continuing appropriations, continuing. So, bakit nabawasan?
Sir.
Diba dapat carried over yan?
Sir, hindi. Kasi it does not necessarily follow na yung leftover appropriation will be carried over. There will be certain items that will not be carried over the next year. So there might be, that is the reason why mas mababa siya the next year. Ganun po yun.
I've been participating in budget deliberations. Ang pagkaalam ko, but of course, I may be wrong, but ito yung customarily nakikita natin. Pag sinabi natin continuing appropriations, it's continuing appropriations. And having said that, since you mentioned that hindi naman lahat ng items nakikerry, we would like to find out what are the items that have not been carried over to sub-item B, allotments. At saka ano yung mga nasakripisyo in terms of the priority programs, activities and projects ng DOH, ano yung sinacrifice nyo?
Sir, Your Honor, ako po bang?
Yes, still DBM.
Yes,
And
sir.
also, DOH, if they know the answer, ano ba yung nabawas na nawala sa kanilang mga programa na hindi isinama doon sa continuing appropriations?
Yun, sir, kung ano yung mga hindi na carry over, I think DOH would be in a better position to explain
Yes.
what items they actually did not continue under yung continuing appropriation nila, which they call CONAP.
Yes, DOH, please.
Yes, thank you, Mr. Chairman. Kindly recognize, please, Director Rowena Laura, the Finance Director of the DOH, Mr. Chairman.
Yes.
Director Wang Laura, please.
Yes, Mr. Chair, Your Honor. Regarding the year-end 2020 unobligated allotment of the DOH, ang total po talaga niya is 24.6 billion. However po, out of the 24.6 billion, only 17.4 billion will be considered as continuing appropriation. 7.1 billion of which po is hindi na nga po magiging continuing appropriation since lapse po ito. Example po nito, sir, yung foreign loans po. Lapse po ito, hindi po siya naging part of continuing appropriation. Same with po.
Excuse me, Undersecretary. Iba yon ha. Pag sinabi nating loans, nasa, I believe, nasa unprogrammed yun. Ano?
Yes.
Or,
Tama, sir.
Tama yun.
automatic appropriations, pareho na carry over, same amount. Pati yung special purpose fund, which is an allocation or appropriation to augment the regular budget. At tinatanong ko lang yung specific budget amounting to 15 billion na nabawasan ng 3 billion. As we can see also on the slide, ano, yung sa 2019, di ba, ang continuing appropriation niya, 6.8 billion. So, nagkaroon lang siya ng increase sa continuing appropriation sa CONAP ng 15 billion kasi nag-carry over pa rin yung kasi mayroong increase na 8.5 billion. Kindly enlighten us, Undersecretary.
Your Honor, Mr. Chair, yung hawak po namin kasing data ngayon is already confirmed na po to sa DBM during our last reconciliation po kung ano po yung naging CONAP and ang naging lapse. So if you will allow us po, we will try to send our data today po para po ma-reconcile itong figures po ng disparity, Your Honor, Mr. Chair.
We also ask COA, ano, kasi sila naman ang nag-flag nito.
Yes po.
Ng computation na tumama do sa difference na 3.192 billion. Sinabi nila under General Administration and Support, Personal Services under Administration of Personal Benefits, 3.051 billion. Now, operation, capital outlay under Health Facilities Enhancement Program, 0.103 billion or 103 million. MOE under Pharmaceutical Management, 0.009 billion. Personal Services under Operation of Dangerous Drugs Abuse Treatment, 0.029 billion. So ito yung mga nasacrifice na mga programs ng DOH. And if we sum this all up, aabot talaga siya ng yung difference na tinitingnan. Kindly cross-check kung tama itong mga programs na nawala sa DOH and why were these programs chosen to be deleted under CONAP?
We'll do that, Your Honor, Mr. Chair. Salamat po.
Okay, sige, utang ha.
Utang po. Salamat po.
Sige. Anyway, next point, next issue. Now, during the Commission on Appointments hearing, and I would like to address this to Secretary Duque, on the appointment, on your appointment as a head of the agency, the DOH. I ask you, I remember this, I raised the issue on the agency supply chain of medicines, since there have been reports of wastage due to overstocking and expiration of drugs and medicine. Ito po yung transcript na ipapakita natin sa screen. Maliwanag po, nag-commit kayo noon. Transcript of records show that Secretary Duque committed in prioritizing the procurement and disposition of supplies to avoid unutilized and idle inventories. Ito po yung sinabi niyo, Secretary. We will do that. It's been my priority. This was last February of 2018 when you faced us, because I was a member of the Commission on Appointment, the Commission of Appointments at the time. I still am. Your Honor, because I will not allow it. Your Honors, that we have overstocking of medicines, and then you added pa. Under my watch, we will not allow this. Your Honor, so we'll make sure that proper systems are in place. The logistics and supply chain reforms must be put in place ASAP, Your Honor. So what happened, Secretary Duque, kasi ito na ngayon, papakita ko yung next slide. Nagkaroon ng overstocking of drugs and medicines. And in the spirit of fairness, I went back further. Hindi lang yung para wag nyo naman sabihin na parang pinopokus ko lang doon sa under your administration since 2018. Bumalik po ako rito hanggang 2013, as a matter of fact. And we can see in this slide, kindly plus the next slide, overstocking of drugs and medicines. Okay, 2013, 4.442 million. 2014, 6.851 million. 2015, and so forth and so on. Andiyan naman sa slide. Ito, meron siyang breakdown. And this came from COA. Because hindi lang yung 2020 COA report ang tinignan namin dito. Ibinalik ko pa yung, just to highlight the point that these are recurring issues. Hindi lamang sa panahon ni Pangulong Duterte, hindi lang sa panahon ni Secretary Duque bilang DOH Secretary, pero recurring ito eh. At saka ang laki na nasasayang, imagine, for the past how many years? 8 years, 2013 hanggang 2020. Ang tinapon nating pera, 2,736,428,600 pesos and 98 centavos. Hindi ba nakakapanghinayang ito? At ang daming walang gamot, lalo sa mga barangays. So what's the reason for this? Why are we overstocking? Why are we buying nearly or nearing expiration ng mga gamot na nag-expire tuloy? So andyan din yung breakdown. So what does this tell us? Sa akin, because I've been an investigator all my life, ang ini-indicate sa akin ito is probably, and this is not, I'm saying not possibly, but probably, merong mafia na well-entrenched na hindi nabubuwag, hindi na-uproot, hindi na-extract. Nandyan, nananatili sa DOH. Pwedeng nag-retire na yung iba, pero pinalitan ng natutumbagong miyembro ng mafia. And unless the secretary or the leadership of the DOH will really put his foot down and do something about this, hindi matatapos itong overstocking ng gamot. I'm sure if I go a bit more or a bit further pa, I'm sure lalabas pa rin itong mga overstocking na ito. And year in and year out, we are wasting hundreds of millions of pesos. Ayan na nga, from 2013, 2.736. Now, Secretary Duque, anong gagawin natin dito? What are the factors contributing to this? Pardon my assumption or my conclusion. But I think it makes sense to think na meron talagang mafia involved in the procurement of drugs and medicines. Because for the life of me, I cannot understand bakit tayo bibili ng malapit na mag-expire na gamot. May suki ba tayong malapit na mag-expire na gamot? Yun ang binibilhan natin lagi. At yun ang, or yun ang nananalo sa bidding. Kindly enlighten us, Secretary Duque.
Thank you, Mr. Chairman. Ito pong binanggit ninyo, yung kasing meron tayong standards kung halimbawa may gamot na dapat 18 to 24 months. Hindi ko lang po hawak, pero may standards po tayo na inihanda ito ng program at saka, in fact, even FDA. Hindi ka pwedeng bumili ng mga near expiring drugs and medicines. So siguro yung near expiry dito po na nakikita natin, baka hindi lang siya gumalaw. kaagad at lumapit na doon sa kanyang expiration. Pero siguro mas maganda po, with your permission, Mr. Chairman, yung aking USEC sa procurement supply chain, ito po ang alam ko, meron na po siyang programa dito para ito ay maibsan. Yung reforms na ginagawa natin, Mr. Chairman, halimbawa sa governance, meron na po tayong Supply Chain Management Office, yung development of the National Procurement and Supply Chain Management Strategic Plan. Tapos meron din tayo yung updating of the Warehouse Operations Manual, yung development of forms and improvement of processes on notification, shipping list and bundling of essential health commodities.
With all due respect.
Yes, ma'am. Yes, sir.
I think ang better approach dito is a thorough scrutiny of the department or the unit under DOH that's in charge of procuring drugs and medicines. Instead of, the theoretical or the usual highfalutin words describing how to go about it. Ako, tingin ko rito kasi well-entrenched imagine. At saka itong nearing expired, overstock, hindi po sa akin galing ito, sa COA ito. And COA, sila yung nasa ground, yung mga resident COA and COA investigators, were the ones who found out or discovered ito mga nearing expired. Pag sinabi natin nearing expiry, hindi pwede yung matagal pang mag-expire pero naging idle lang. No? Kasi iba yung expired. Imagine magkano lahat yan na expired na yan. Pag inalis natin yung overstock at saka yung nearing expiry, yung expired, ito yung talagang wastage. And wastage of public funds. Now, hindi ba mas maganda po na pag-aralan natin mabuti unless, and I don't want to believe that you have been co-opted because
Thank you, sir. Thank you, sir.
I believe that. No? So, if I may suggest, I think an investigation is in order to find bakit lagi na lang ganito yung ating pagbili o pag-procure ng drugs and medicines. Imagine, 2.7. Pag bumalik pa tayo ng another 8 years, baka umabot na ito ng 5 billion. And nag-commit po kayo ng 2018, February 7, when you faced us in the Commission on Appointments. Pero 2019, lumobo o naging 2.2 billion yung overstock, expired sa nearing expiry. Hindi po dapat, di ba dapat hindi na COA ang magre-raise ng red flag dito? Dapat kayo na.
Yes, sir.
2019, a year after you committed during the confirmation hearings, lumobo pa siya ng 2.2 billion. So kung ako yung, of course, theoretical ito, no? Kung ako yung nasa position, gagawin ko agad. Titingnan ko, may mafia ba rito? Bakit taon-taon ganito hindi nagbabago? These are recurring issues involving drugs and medicine. Now,
yes, sir. Yes, sir. Magpapaimbestiga po ako dito. Yes. Lalo na yung sinabi ninyo na yung may mafia. Kailangan talaga itong...
Ako yung mag-iisip. Yun lang iisipin ko kasi recurring. Sana kung isang taon lang tapos nawala, maaaring kapabayaan lang. Pero pattern na po ito Secretary. So please.
Yes, sir. Will do that, sir. Yes, sir.
Issue, I'll fast track this. Yung deficiencies on management of HPEP equipment. Ito po, mas malaki ito. 4 billion plus over a period of 7 years. From 2014, andyan this slide. Kindly show this slide. Itong HPEP, ito yung banner programs, one of the banner programs under the Aquino administration kasi nagsimula ito 2014. For the upgrading of health facilities and providing training to health professionals to improve the access of people to quality health care. Yeah, the proper implementation of this program would have been beneficial to our response to this pandemic, especially now, mayroong pandemic. Now, ako, ito, matter of record, I supported the SPEP of DOH in terms of my institutional budget amendments kasi pag nag-amend ako, it's always institutional. As I believe that this is an integral part of our universal healthcare system. Crucial ito sa efforts natin to respond to the health crisis. For the 2020 budget alone, I propose an increase of in the amount of 1 billion pesos. In 2021, nag-propose na naman ako ng increase na 8.68 billion. Sinusuportahan naman po ito ng mga kasamahan ko kasi alam nila na importante yung compliance sa universal healthcare. Pero pag nakita natin yung lapses in the implementation, ito, COA report din ito, through the years, in 2020 alone, equipment in the aggregate amount of 1.2 billion procured under HPEP were found to be either undelivered, unutilized, and without calibration and preventive maintenance. So sayang na naman yung pera ng bayan dito, Secretary. What can you say? Please, Secretary Duque.
Mr. Chairman, can you hear me?
Yes, I can hear you.
Magagamit pa naman ho ito, Mr. Chairman. I-recalibrate lang para nang sa ganon makatulong sa atin mga diagnostics sa mga DOH retained hospitals. We have about 74 retained hospitals. So papacheck ko po ito kaagad kung ano ang naging estado nitong mga makinang ito. I will order the regional directors to give me a report on the wherewithal of all of these equipment amounting to in 2020 1.2, in 2019 716 million, and so forth down the line. So titingnan ko po baka naman ito ay masalba pa ito at siguraduhin lang na makuha ko yung report at ano yung mga recalibration efforts na dapat gawin to make them functional. If they're not yet functional, Mr. Chairman.
Thank you po. Hindi ito usapin ng corruption, usapin po ito ng inefficiency.
Yes, sir. I agree, sir. I do agree, sir. Masakit po ito na ganito po.
So, for that matter, can you just give us a detailed inventory of all HPEP facilities in the country that are actually serving the intended purpose of the program?
We will do, sir. We will do, sir.
Pati mga deficient?
Yes, sir. Lahat na po ng inventory, yung functional, yung deficient or already I don't know what the term is, yung hindi na po magamit at gano'n na katagal itong mga makina na ito.
Pakilista nyo lang lahat yung utang.
Please wrap up.
Yes, sir. We will do, sir.
Ito, another issue. Yung deficiency or deficiencies in the management of HPEP infrastructure projects. Ito, malaki.
Saan nakalabas yan?
8.5 billion pesos. So, isama nyo na rin ito. So, ang
yes, sir.
Rito, we're depriving the public of the benefits that they could have derived from the immediate and maximum use of these facilities. Hindi ba? Kasi kung mga deficiencies, medyo nasi-shortchange natin yung, sabihin natin yung customers ninyo, yung clientele, the public. Kasi alam nyo, yung health napaka-importante, hindi po ba sa ating bansa, sa ating mga kababayan. Tapos makakakita tayo ng 18.5 billion or almost 18.6 billion na mga deficient at saka inadequate yung serbisyong binibigay. So, another utang, Secretary?
Yes, sir. Itong management of HPEP infrastructure projects, magpapagawa ako ng inventaryo ng lahat ng mga kontrata nito. At tingnan ko kung bakit hindi natapos at ano kaya ang mga circumstances. Dahil, so I will have all the contracts reviewed, Mr. Chairman, Your Honor.
Maraming salamat po, Secretary. Now,
Senator Ping, we're being told by the Senate President that we must finish by 2:30. So actually your time is up, but I'll give you time to wrap up.
Sige, last point, ito sa round. Pero sige, Mr. Chairman, if you want to, para makapag-prepare din tayo sa session, but ito na muna, last point on this issue. Ito, another point of concern is the disbursement of various DOH, ito, lahatan na ito, various DOH operating units that did not comply with established rules, procedural guidelines, policies, principles or practices. Alam nyo, ito binabantay ng COA lagi. Irregular, unnecessary, and excessive expenditures. Pag nakakita sila ng ganyan, either one of the three, talagang red flag ka agad yan. Tama po ba yan, Chairman Mike?
That's part of the compliance audit that's done together with the annual audit.
Basta nakakita kayo ng irregular, excessive, saka unnecessary, red flag na agad. So, ito, 956 million pesos, starting from 2016 hanggang 2020. Can you, DOH, anyway, we don't have time anymore. Can you elaborate? Pakisama nyo na rin sa i-report nyo ito sa amin, Secretary.
Certainly, Mr. Chairman. So, ang akin pong marching order sa mga implementing units ay magpadala sila kaagad ng kanilang mga paliwanag dito sa mga irregular, unnecessary, and excessive expenditures. Kung ito ba'y lumalabag sa ating pong mga panuntunan at posibleng humantong ito sa mga notice of disallowances later on. But I would like to correct this even before it reaches that stage of the investigation by COA, that is. So gagawin ko na lang po ito, Mr. Chairman, na titingnan ko ano yung mga rejoinder, bakit nagkaroon ng ganito, at kailangan ito po ay matugunan ng malinaw, bakit nangyari, ano ang gagawin nila. Alam naman po nila yung kanilang pananagutan dito sa mga observations ng COA. Yun lang po, Mr. Chairman.
Pwede silang humarap ng sa ombudsman dito kasi pagka nagkaroon ng notice of disallowance o kaya nagkaroon ng technical malversation and so forth and so on, medyo baka may pagkalalagyan. So anyway, Mr. Chairman, I have many questions more addressed to Undersecretary Laos, but since we lack the material time, we have a session at 3 o'clock. I will suspend my interpellation and hopefully next time that you resume the hearing or the inquiry, baka pwedeng we take off from we left off. Kung sino yung huling natapos, baka ako yung pwede magsimula. Kasi I've been here this morning. Alam nyo,
I know, all of us have been here.
Nag-log in ako at 9:30 thinking na maaga ako. Yung pala si Senator Amy, 8:34 naka-log in na. So naging number 9 ako sa list. So thank you, Chairman. That's all for now.
Thank you. If we were short on that, I apologize, but I was just given the list by my staff on who came in. But thank you for your questions. They're very precise. I have two quick questions lang para kasi it's no point investigating and DOH is like a target that we're hitting based on the COA report. But really, one of our intentions principally is to make sure that they're able to vaccinate and be able to test so that we know who what needs to be done because we have to get rid of COVID. We have to beat COVID. And so the next hearing, we will concentrate on that along with the discrepancies and the irregularities. So I'd like to tell everybody, with the permission of everybody, I don't want this to lag. I would like to call the next meeting on Friday para hindi tatagal. Tomorrow I would have wanted to do that, but House of Representatives have their own hearing. So I have a JBC on Friday, but I will be able to get out, I suppose, by 1:30. And by 1:30, we should be able to start and up to the wee hours of the next morning, if we need be. We've done that before. But we will call everyone and we will all have a chance to find out from Undersecretary Lau many of the things that we have laid the predicate on. I assume, Secretary Duque, that you've already submitted the matters that we wanted to be submitted to us. Have you done that?
Yes, sir. In fact, I have a report that of the documents requested, out of 19, we have already submitted 16, for an 84% compliance, and then ongoing is 3. Sir, of course, this list goes on because we have a new request in today's meeting. So we will act on this very quickly, Your Honor.
Director General of the Blue Ribbon Committee is supposed to receive them, and I have not been given the information. But after tonight, I suppose we'll be able to check on them and be able to pursue the investigation in a more cogent manner. Right now, it's kind of everybody has to ask their questions, but I try very much to make sure that we're focused, that we don't stray from the path, and not to give our friends in the executive a very, very hard time, because that is not our intention. Our intention is to seek the truth and to make sure that we balance out serving our country more than dramatically than serving it very, very in a very least way. So with the permission of everybody, I will call the hearing on 1:30 on August 27th at 1:30 p.m. If that's okay with everybody, I will now suspend the hearing. But before you do that, I just want a quick question to Secretary Duque. How many vaccinators do you need to complete the vaccination? Of course, you'll always need them, even if they've been vaccinated already. Are we going to have booster shots? When are we going to have booster shots for the 12-year-olds going up, so that many of them can go back to school as well? Would we be in the right direction if we ask those questions later on from the standpoint of the aims and purposes of DOH?
Yes, certainly. For the next meeting, we will answer these questions. I've taken down notes on what you have said. But right now, for the vaccination program, we have requested for 4,800 additional vaccinators. And our goal is to jab or inoculate 500 to about 700,000 per day, supply permitting. And if we are able to do that, then we should be able to reach herd immunity with second dose, of course, no, sir. Probably mid first month or second month of first quarter next year.
The second quarter of 2022, just in time for the elections.
First quarter, sir. First quarter. Mga second month of first
Sounds
quarter.
like we're aiming for the election. So anyway, but the important thing is, are you able to get 700,000 a day? How many are you able to get right now?
400,000 a day. There were days when we were able to log in about 650. The highest was 700,000. So in terms of efficiency, kaya naman po. Yun lang talaga sa supply lang, sir, na nalilimitahan na tayo. Salamat po.
And finally, can you give us a reading talaga? Yung testing has always been questioned. I really feel that dapat malinaw sa tao na libre ang test na binabayaran dapat ng PhilHealth. Di ba correct yan?
Yes, Your Honor. Certainly. Our testing capacity naman is about 101,808 tests per day. So we should be able to maximize this, Your Honor, Mr. Chairman.
Yes. Now, the question is, para magpa-test na nga yung mga tao, alam nila sagot ng gobyerno yung kanilang test para lahat makakaagwanta, no? Dahil kung hindi, naandyan yan. Sagot ko nga doon sa iba, nalalaman natin kung anong rate natin by testing. Katulad yan, ano ba kahapon? 18,000 kahapon, di ba? Ay ngayon, ano ba maabot ngayon? Tumataas pa?
Kahapon po, we have 12,300 plus cases, if you are asking for the number of cases.
Yes,
the other day was 18,000, sir.
Yes, that's right. And do you see that increasing pa?
Well, it's hard to say, but based on our projections, mukhang tataas pa rin ito because the 2-week ECQ results will only be seen perhaps beginning September 4 or second week of September.
All right.
Mr. Chair.
Okay, on that note,
Mr. Chair. Senator Angara, Mr. Chair.
I want you to know that the Senate President has already
yes, Mr.
admonished
Chair,
me that we should finish by 2:30.
I was
Go
just
ahead.
going to ask Mr. Chair, as a procedural matter, would it be possible to pick up where the list of questioners today? So meaning,
Yes,
I think Senator Hontiveros is next, and then I think Senator Poe, and then myself. So could we still follow that order for Friday's hearing? Just a respectful
yes,
request,
we'll do that.
Your Honor.
We'll do that.
Thank you, Mr. Chair.
Thank you, Mr. Chair. Thank you, Senator Sani.
All
Thanks,
right.
Senator.
Okay. Great. So on that note, this session is suspended until 27 August 2021 at 1:30 p.m. We'll see you there. And everybody is on notice that they're still invited and they've been called, and those who have been subpoenaed must come. And I think there will be more focus now on the very, very hard issues that have to be explained. Thank you very much. Session
Thank
is
you, Mr.
suspended.
Chair.
Thank you, Mr. Chairman, in behalf of the DOH. Thank you, sir. Thank you, Your
Thank
Honor.
you. Thank you very much.
Thank you, Mr. Chair.
Thank you very much.
Thank you, Mr. Chair.
Thank you po. Thank you.
Thank you, Mr. Chair.